All right, everybody, welcome back. It is a sunny Thursday morning, Thursday, May 14th, 2026. Welcome to the Chutes County Budget Committee for day 3. We will first note any changes. I believe that we had gotten some information last night that we need to make sure goes on the record, correct?
Yeah, so yesterday, the Budget Committee had a question about, or for the clerk, about the cost of the voter pamphlets. And so Steve provided the amounts. In May of 2024, it was about 13,000. In November of 2024, about 20,000. And then May 2025 was about 25,000.
Okay.
And then Laura has also passed out, you'll have a new special request summary sheet, which has the revised request from the assessor. So reducing that down to the 125,000 from the 350,000.
Okay.
So I have a question. Was that number for the production of the voters pamphlet, or does it include the mailing of the voters pamphlet?
I'm not sure. I'll have to clarify that with Steve.
Because you just said voters pamphlet, so I just want a clarification as to what that number.
Yeah, I'm not sure if that's production and postage and mailing, or if that's just
We
production.
could get clarification. on
Yeah,
that.
it's too uncertain.
Yeah, it just sounds like kind of a really low number, so I'm just wondering what that entails.
You get the number of pamphlets that were produced with that too?
Yeah.
Okay. We will continue on going on that. Are there any agenda changes that we want to do? We did note that we were likely to move the special requests up to the 11:15 timeframe after the Summer River Service District presentation. And we will adjust the agenda on the fly in the afternoon as necessary. Any other agenda changes or any other information that we want to get before we start? If not, I will open for public comment. Is there any public comment in the room? Seeing none, is there any public comment online? Seeing none, we will move forward. And our next item on the agenda is health services, and they're not in the room yet. So let's stall otherwise.
They're next door.
Oh, there we go.
Mhm.
Were you like in the other room doing the hype thing?
Yeah.
Mirror in the other room. I'm important. People like me. Get settled, and then you can introduce yourselves. I will just note that there's at least one person up on the podium that picks a mean dessert in the dessert dash.
It's me. I know my dessert's
Pretty
pretty.
doubt on your abilities, Holly.
Yeah, I did not take it that way. Cheryl is critical. Right.
Well, good morning, everybody. My name is Holly Harris, and I am the Health Services Director.
And I'm Cheryl Smallman. I'm the Admin Services Deputy Director for Health Services.
So I first want to start off by thanking you for your time today. I've been with the county for over 13 years and have participated in several budget hearings, but this is my first as the Health Services Director. And boy, did I pick a year to start. So you'll hear all about that as we go through our presentation. But we began this budget cycle preparation facing unusual uncertainty at the state, federal, and local levels. CCO and Medicaid outlooks still remain unclear. State and local funding seems to have stabilized for now, but it's definitely not keeping pace with our increasing costs. We expect federal impacts to really hit us in FY28, and our team is already planning innovative ways to manage the likely reductions. I'd like to take a moment to express how proud I am of the Health Services leadership team for their willingness to take a hard and honest look at their budgets and make some very difficult decisions, which you'll hear more about today. Their commitment to our mission, which is to promote and protect the health and safety of our community, guided every single step of this process. Despite the challenges, I am optimistic about FY27 and about the work already underway for FY28. I know this department, our leaders, and our staff will continue to do everything possible to keep our community healthy and to continue to support those who are most vulnerable. I also want to take a moment to just thank Deschutes County 911 and Deschutes County Sheriff's Office for the financial contributions to our crisis services. Their partnership is critical to our success, and the financial contributions are incredibly meaningful and appreciated. I want to take a moment also to thank the Board of County Commissioners, the county admin, facilities, community justice, finance, legal, and HR for their collaboration this year, which helped us find and implement many of the creative solutions that you will hear more about in our presentation. And of course, I can't go without thanking Cheryl Smallman. Without her expertise, the road ahead would be much more daunting, and I'm really grateful for her leadership in health services. Hope you have the thing. Cheryl's going to advance the slides for me here. Okay, so as you see, our mission is front and center of our slides and really did guide every single step of this process for us. We are the largest county department, and we are structured with 3 main service areas. So the largest being behavioral health with about 263 FTE, followed by public health with 70.85 FTE, both of which are supported by our amazing admin services division with 58.2 FTE. And you see the director's office there in the center with myself and Emily Burke-Smith, who was also really critical in helping create everything in your binders for you. So thank you to her for that. As you can see, in December, we made the very difficult decision to eliminate 10.35 FTE. We did that based on the information we had at the time related to the gaps that we were likely facing in FY27. With additional information that came to us through the budget process, we had to make the even more difficult decision to eliminate another 14.25 FTE, one of those being a limited duration and 6 of those actually being layoffs. That's a total of 24.6 FTE, which represents about a 6% reduction in our workforce.
I just want to call out one change or clarification that has been made. She stated 1 limited duration and 6 layoff, and your slides show 2 limited duration, 5 layoff. So that is a correction that we've made after we did some fact finding.
I'm just going to go through the next 2 slides at a high level because a lot of this is outlined in your annual report, which you do have in your binder. But both public health and behavioral health are statutorily designated functions outlined in Oregon revised statutes. So we'll start with public health. Public health constitutes a variety of mandated and unique services as a local public health authority. It is our job to prevent and protect the public from the spread of disease and promote health and safety in our community. Each local public health authority in Oregon is required to deliver specific programs such as communicable disease, environmental health, and preparedness. While some of these programs listed provide unique and direct services to individuals, the vast majority of public health touch all of us and work quietly behind the scenes to keep our community healthy and safe. Similarly, community mental health is also statutorily designated, and as you all know, our Board of Commissioners is both the local public health authority and the local mental health authority. So in community mental health, we kind of break it up into 3 buckets with our mandated services, which have a direct responsibility for services that have a legal impact on individuals' rights. So these are things like civil commitment, aid and assist, which you heard our district attorney talk about, I believe, yesterday, as well as individuals who are found guilty except for insanity through the Psychiatric Security Review Board. Then we have our core services, those are which are outlined in Oregon Administrative Rule and our county financial assistance agreement. These are things like 24/7 crisis services, wraparound services for youth, among others. And then we, of course, have our safety net services. And so these are the things the CMHP is required to ensure the provision of services that are not provided elsewhere. So things like school-based health centers, mental health substance use, outpatient, and supported employment, among other things. All of this is outlined in our local plan. If any of you are interested in reading our local plan, we'd be happy to provide it to you. The Board of Commissioners has received a copy. This was something we have to submit to the state that outlines all of this in great, great detail. So as a community mental health program, we are also a certified community behavioral health clinic, and we are one of 12 in the state of Oregon and have been since 2017. So I know many of you have heard lots about CCBHC and all that it's done for our community and our organization. Just at a high level, it is a clinic model with defined service requirements, and we are expected to serve everyone regardless of payer. We are also expected to provide services in the community and provide them in an equitable way. And there's a high focus on the whole person care and integration with physical health. From a budget perspective, we receive an enhanced reimbursement payment, which is called the Prospective Payment System, PPS. You'll hear us refer to that as, that helps cover some of our uncovered costs. As a result of CCBHC, we have generated over $36 million in revenue since 2017. Oregon did institutionalize CCBHC through the Medicaid state plan, I guess last year. Yeah, I think it was last year. And so again, while we're 12 currently, and we are one of those, the state is looking to expand this statewide to increase it to an additional 15. So it's feeling from a model perspective, like a stable program that Oregon is committed to, which wasn't always the case. But we are still watching it really closely because it is a Medicaid program. And so we're going to be watching what a reduction in Medicaid enrollment might do to our ability to generate revenue in the same way. So that's just something we'll be paying attention to in FY28.
You give us the ending balance of that for 26 then? For
our reserves?
yes, for the reserve.
Yeah, for fiscal year 26, we estimate that we will, sorry, that's Fund 274. Fund 2 will be at 40.7 million.
And one of the important things to note about our reserves is that while we generate revenue through our reserves, the model works really well right now in terms of covering some unexpected and uncovered costs that come up for us. We can fill that without having to rely on general fund. The buildup of the reserves really came about during the pandemic when we were unable to reinvest those dollars back into our budgets due to a variety of really valid factors that were at play during the pandemic. So that's how we were able to build it up. And I'm really very, very grateful that we have that reserves available to us as we head into some what we're going to believe are very challenging times ahead, where we're going to be heavily reliant upon our reserves to help us navigate those difficult times. Yes.
On the contracted services,
Mhm.
can you expand on that? What does health services utilize for contract services outside of the county employees, and how much do we pay for those services?
Yeah, so I can give you a high level. We're going to go through this whole slide in more detail. Well, I can quickly hit on contracted services. We have a variety of things that we contract out. One, like for example, one in behavioral health, we had a contract with Youth Villages where they would provide ongoing crisis support for people post-crisis for up to 56 days. We made a decision this year to, collectively, they were also not interested in doing any longer, but we brought those services in-house. And so we are going to be using that money to offset our costs, but do that work with existing FTE. Cheryl can talk about all the various other contracts that we have related to.
Yeah, we've got contracts anywhere from supporting janitorial or mail and courier service. That's one that we've eliminated for fiscal year 27 as well, all the way to supporting partners that may be doing
we had some contracts with Pfeiffer and Associates, for example, is one example. They do specific SUD services for individuals who were indigent. And they would do some sort of post-jail activities for clients with SUD, substance use disorders. And so part of the reason we had contracted those out in the past is that the contracts were so small that it wouldn't actually pay for any FTE for us to be able to do that work. So when the contract money is small enough, sometimes there are providers in the community that can do some of that work for that price. That's kind of sometimes how we make those decisions. Pfeiffer, and they're no longer around, so those contracts ended, and we are bringing that work in-house. So that's another example.
I would think of the Iris Telehealth.
Irish Telehealth is a huge contract.
This was, we didn't have sufficient behavioral health clinicians to do all the work. And so we were using a virtual, provider remotely, and we're ramping that down now because, with the volume of work and the funds available, it makes more sense to produce the service directly ourselves versus contracted.
And I do have a whole slide on that because we've done some incredible work with the support of the Board of County Commissioners to disentangle ourselves from very expensive contracts like that actually are cheaper to provide in-house with in-person services, but workforce issues played into those contracts. We also have a contract with staffing agency that helps support the stabilization center because of workforce issues. We often struggle to find overnight staffing. So there's various reasons why we might enter into a contract. But we have made some conscious efforts to reduce some contracts where we could and bring those dollars in-house so that we can offset some costs. So just in terms of this entire slide, this slide really does outline the strategies that span the entire department that we implemented to contain our costs going forward for FY27. Each service area, of course, is funded very differently and has their own unique needs. And we're going to go into what they did individually within their service area to contain costs after these slides. But again, this is at the department level that we did this. So the first thing we did was, first to kind of set us off, in early November, our estimated fiscal year 27 gap was about 1.8 million. That's when we made the difficult decision to eliminate 10.35 vacant FTE at that time. That brought the gap down to about 500,000. And then market analysis hit. And so I just do want to say the health department has been 100% behind doing market analysis, the method in which market analysis was done, as well as pay equity. We feel those are important strategies to recruiting and retaining high quality workforce. And we can't do this work without high quality workforce. And simultaneously, there's a fiscal impact to our department as a result of that. Both can be true, and both were true in this case. So the market analysis in particular, the department took about a $5 million hit, which was about half of the total market analysis cost. And so that then required us to implement some additional strategies to prepare ourselves for fiscal year 27. So the first one we focused on was workforce. We immediately implemented a hiring pause. So we did not do a hiring freeze, which would have just immediately stopped us from hiring anybody. We didn't feel that was the best strategy because some of our positions are revenue generating. There's just so many factors in terms of why it makes sense to fill a position or not. So we implemented a hiring pause, which essentially escalates every vacant position up to the director level. Cheryl, Heather, Shannon, and I meet every Monday, and we review every single vacant position, and we decide whether or not it needs to be refilled immediately, whether we need to think about reallocating it to something else that's more critical for the department, or whether we eliminate it altogether. So that's continuing on, and that will continue through FY27. We implemented voluntary FTE reductions. This was something we got from Community Justice. Part of why I thanked them in the beginning too is they really led the way on developing how this could look. It like Community Justice, it really didn't go very far. We have, almost 400 FTE, and we had 4 people take us up on this offer that were approved for a reduction in FTE, but that's still a reduction, and it saved us some money, and it was helpful. Then we decided to implement voluntary furloughs. So this was an opportunity we offered to all staff to take 1 day per pay period for 11 months. And we did 11 months because the month of November already has a furlough day for the day after Thanksgiving. So it's a total of essentially 1 day per month, which we felt was manageable for our operations, but also would estimate several $100,000 in savings. And we did have a robust taking on that offering. So that is something we're exploring for this year. We're going to reevaluate at the end of FY27 to determine whether this is something we want to continue into FY28. This was a strategy to also help set us up better for FY28 when we know we have some additional impacts coming. And then, of course, we have our reduction in total FTE, which we'll talk about in detail in the future slides. In terms of our operating costs, one of the things I was going to highlight was the contracted services. We reduced our contracts by about $1 million, bringing some of those services in-house to do. And again, some of them just were eliminated due to just no longer needing that service. One of the more difficult decisions we made was around our square footage. We know this is a long-lasting impact that will be to our department, and it's not that those buildings were vacant. They were heavily utilized. It's not that we didn't need them. We just needed to make some difficult decisions to save some money in terms of internal service fees, as well as all of the costs that are associated with having a building, utilities and, mail and all the things that come with having a building. So we reduced our square footage by about 14,500 square feet. We vacated the Mike Meyer building, which is downtown here in Bend, and the Antler building, which is in Redmond, that housed our intellectual and developmental disability services, some of them, as well as the 236 Kingwood building, which housed some public health services. So remember, Kingwood has two buildings. One is 244 Kingwood, which is primarily a behavioral health building. 236 has a variety of county departments in it, including one was public health. We, because of some moves that took place with Mosaic vacating some of our space and reduction in FTE and a number of other factors, we were able to find spaces for all of the people in those buildings in our existing buildings, having to get pretty creative with some shared space options and hybrid and some other things. But we are almost entirely through the moves, and I have to just thank our project management team and many others who helped make those moves happen very, very quickly. I think we made the decision in March, and they have to be out by June 30th. And I think our last move is next week. So we were able to pull it off, and I'm really proud of that team for doing so, and the staff for their willingness and flexibility. One thing that's not on the slide that is also really important, though, is that we did purchase a building near our Courtney building, which we refer to as the Wyatt building. This had been a building we had been leasing. Lease costs are very difficult for certain parts of our department, particularly public health and IDD. So we decided to leverage our behavioral health reserves, purchase the building, get out of a lease, transition that building to be a primarily behavioral health supported building. And we'll be relocating portions of public health out of that building in order to do that. But that's kind of one of those creative ways of how can we use our reserves to offset costs for the other parts of our department. So kind of diving down a little deeper into each service area. So starting with public health did reduce by 5.1 vacant FTE. They also discontinued participation in the Family Connects Oregon program. And that was a difficult decision for us because we really believe in universal newborn nurse home visiting. I mean, it's a good thing. You've heard us up here, I think, over the years talking about what an incredible program it was. So we didn't take that decision lightly, but it really wasn't a fiscally sustainable model, particularly given our reimbursement issues with private insurance, as well as just the funding limitations within public health and some of the constraints we were facing there. We are still very committed to continuing our focus and our resources on core safety net programs, including things like WIC, perinatal care coordination, Babies First, and Cocoon, all which serve high risk, very vulnerable women, infants, children, and families. And this is still a central part of our mission in public health.
Just a question on that. When you discontinue programs like that, do you see private or nonprofits that seek to pick them up, or is that part of the discontinuance? You're trying to find that?
I don't, there's not any nonprofits in our community that have raised their hand to want to pick up that program. I'm not even sure if the funding would allow. I'm not even sure if there are nonprofits within our community that do that. I'm looking at Heather, and she's probably teamsing us right now. But yeah, there's no way picking up that. And what is nice about our services in public health, though, with Babies First, our regular nurse home visiting, Cocoon, perinatal care coordination, it's very similar work, but it's just really more targeted and focused on more of the high-risk population, whereas the Family Connects was focused on any new mom. While that's wonderful, and we think every new mom deserves every bit of support they can get, the resources just really weren't there to sustain a model like that. And so pivoting to sort of serve our most high risk is really where our public health department has to spend its time and resources.
Understand. Thank you.
It sounds like the hospital possibly could pick this up, and that private insurance has maternal options for their clients as well.
So that'd be great if that can transpire. So public health continues to leverage current funding models and efficiencies. You'll hear us talk about efficiencies a lot in this presentation today, because that is a key area that we are spending a lot of time and energy to say, how can we look at everything in our department, find the most, reduce redundancies, create efficiencies. And one of the areas we're able to do that was environmental health, and able to look at how that's operating, create some efficiencies and cost savings, which allowed us to only increase fees by 3.6%. So that we felt that was as good as we can get right now. Admin services did their part, certainly, with reducing 3.0 vacant FTE, which was in public health and behavioral health front office, as well as a senior quality analyst. They looked at reducing all non-essential expenses, including on-call services, contracted services, travel and training. Behavioral health, they reduced by about 10 FTE across FY26. 3 of those were layoffs. One of them was an ending of a limited duration position. We also had to make the very difficult decision to sunset our harm reduction program. This was primarily tied to a reduction in behavioral health resource network funding. So that's the Measure 110 funding that's tied to marijuana tax revenue. When we applied for our grant at the last year, in 2025, we took a $2 million hit on a reduction of that grant funding, which forced us to make the difficult decision to sunset the harm reduction program. Unfortunately, halfway through this year, they made another 14% reduction in burn funding, which caused us to have to do an additional layoff in our homeless outreach program. So while we're sunsetting the program within health services, there has been an enormous amount of work, and I have to thank Leslie Corliss, who's the coordinator for that program, and a number of other people who have helped her transition as much of the services as we can to community-based organizations that have really stepped up and helped and are very committed to providing this critical service to a very vulnerable population. So we're grateful for that partnership, but we will be ending it for Deschutes County. So we also ended, again, I talked about this provider contract, the Youth Villages contract, where we are now going to bring those follow-up crisis services for the 56 days that will come in-house. And that was a rather large contract that will come in-house, and we'll do that with existing staff. It was a big lift for us to pull that off, but we think it's the right move. We also made the difficult decision to end our paid internship program, which is something we had worked really hard to build up over the course of the years, but there really wasn't a funding mechanism to keep that going long-term. And then, of course, we're obviously leveraging funding models and reserves wherever possible and appropriate. CCBHC, we're applying for the Rural Health Transformation Grant. So any opportunity that comes our way where we can leverage additional funds, we will be looking at this year.
In general, how's your luck? How is your luck in grant applications? I know that they've been drying up pretty broadly.
Yeah, we'll see with the Rural Health Transformation. That's a very competitive one. Everybody I know is applying for that one. So we'll have to see how that plays out. I think, Public Health's applied for some grants and gotten them. It's kind of hit or miss depending on where the grant funding's coming from. It's also it's always a balance to decide whether to apply for a grant with so many strings attached. Federal grants are a bit uncertain right now in terms of whether they'll be continued the next year. And sometimes the grants funds are just not for very long. And so then to build up a program based on very limited duration funding doesn't necessarily always make sense. So we have a very robust internal process by which we decide if we're going to actually apply for a grant, because we have to think about the admin costs, whether the indirects are covered, lots of various factors that we weigh before
There's
deciding.
195 million in that grant, and I would believe because it's applying to rural health communities, and then I believe it's going to be like 200 million the next 4 years.
Yeah, that's a big one. That Rural Health Transformation one's big.
Right, it's huge, and it is for communities that really need that
Yeah,
help.
and-
So I would think that Lapine would be
Yep.
at the top of the list there.
I would hope so. Well, we're going to go for it for sure.
Right.
Yeah, that's definitely.
What are we applying for, do you know?
Shannon, do you remember how much we're applying for?
Yeah, it's like 1.2.
Yeah.
1.2 million.
1.2 million.
Okay.
And we have received word that public health is receiving some of the direct allocation from the RHTP. So that will be about 550,000, 580,000 through November of 27, I believe.
Good.
Yeah, so that's new information. We're working on that application.
580,000 then.
580,000.
We'll be coming before the Board of
Yeah.
Commissioners on that soon.
Good news.
So intellectual and developmental disabilities, which has been especially hit this hard, and you will see more about in our special request slide that we have, which is going to be related to IDD. They've reduced 6.5 FTE. 3 of those are identified as layoff and tied to our general fund request. And of course, they reduced all non-essential expenses. Carol.
Great. Well, that certainly begs the question, what is in our proposed budget? Just to orient you a little bit before I go into the details, Health Services has 2 funds, as Commissioner Adair alluded to. We have the Fund 274, which is our operating fund, and then Fund 270 is our Oregon Health Plan Behavioral Health Reserves. In your binder, you should have a plethora of details or pages that talk through details.
You can find that in the supplemental materials section.
The supplemental material section. Great. Thank you, Cam. Page 1 is my annual personal favorite, so I'll just draw your attention to that. It has Fund 274 at a high level summarizing each division as well as program. And it has a year-over-year revised budget comparison, revised budget to the fiscal year 27 proposed budget. It also outlines the county general fund year over year, so you can see where it's being allocated and any changes that are made. And then on the far right are the FTEs. So if you're curious how things are changing year to year, that's a good place to start. We also have high-level summary. So 2 and 3 is a high-level summary of resources and requirements at each fund level. 4 through 6 is at the division level. 7 through 12 is at the public health program level. 13 through 20, behavioral health program level. 21 and 22 is admin services. And why that's important for those who may not be familiar with health services is that our funding is very specific oftentimes. So it's not flexible. Some is, but much of it is not. So when we talk about how things are changing, how we're leveraging funds, we spend a lot of time optimizing and talking through what we can do with existing dollars to see if we can make better use of it. So on the slide in front of you shows what is in our fiscal year 27 proposed budget in terms of the resource side. Government grants and payments make up the largest portion at 35%. That is a 9% decrease year over year. Much of that is associated with a one-time behavioral health housing grant that we anticipate spending and using this year, if all goes well, this fiscal year. And that is helping us to expand adult foster home.
Yeah.
And some remodeling to Brighton Bush.
Yes, we have several adult foster homes, one that's specific to IDD and mental health that we're using the dollars for. That'll add 5 beds. Another one that's specifically a mental health adult foster home. And then we had a provider vacate one of our existing adult foster homes. And that building is one we own and needs extensive remodeling. So we're going to be able to use those dollars to do that and bring in a new provider for that. And again, we're adding at least 10 beds with the 2 new adult foster homes.
Yep. The second largest resource category is capitation and fee-for-service. These are Medicaid dollars, specifically tied to our coordinated care organization contract, which is currently with Pacific Source. That makes up, I think I said 22%. That is a 12% decrease year over year. We are still finalizing the contract, so we're going through negotiations. This is an estimate at that time. We are hopeful that it will come in better than what I currently have, but I think optimistically, best case is still an 8% reduction year over year. Charges for services makes up 4%. Primarily what's in this one are environmental health fees. And as Holly stated earlier, we are proposing a 3.6% increase to fees, which ties into the next bullet point. The transient lodging tax also supports environmental health. That's an increase of 2%, as you're aware from earlier in the week. We also use video lottery funds to support environmental health. That received a 5% increase. And this is in addition to 0.5 reduction in FTE to environmental health. And then last but certainly not least, county general fund limited growth allocation is limited to 4%. So we've got a 4% increase here. Questions on the resources? Okay. Requirements. Not surprisingly, personnel makes up 73% or the majority of our expenditures. That is an 8% increase year over year with the reduction in FTE, as we've already talked through. We also budget vacancy savings, and that fluctuates depending on the division. Behavioral health, for instance, is budgeted at 7%. Public health is budgeted at 3%. So we look over trends over time and take into consideration any adjustments to FTE. M&S, materials and services, make up 8%. That's a reduction of 23% year over year. We've talked about some of those changes already and really limiting where we can. In addition to that, we had a number of either on-call or temporary help that we typically utilize. And so this year we won't be leveraging some of those external resources. Internal service fees, especially with the new drivers this year, are an increase of 1% year over year. And then the budget does include some major one-time expenditures. We have the continuation of the Lapine remodel at the Lapine Clinic, which is $1.6 million. That's a transfer out into the facilities fund. And then the renovation that's in the capital supplemental there is the behavioral health housing for Brighton Bush at $691, paid for through a grant. Questions?
Okay. Moving along here. So looking at our FY27, both short-term and long-term fiscal issues. So short-term, obviously, I think the name of the game is just uncertainty, instability, constraints that we're facing. The CCO negotiations, is our most pressing concern at the moment. We are still knee-deep in the middle of those negotiations, and hopefully in the next few weeks have some sort of solution moving forward, but that's a big one. Workforce reductions, we've talked a lot about vacant FTE reductions, but we also had some layoffs. There was not a position in the health department that was underutilized. And I think if you had asked anybody within the health department, they would have all raised their hand and said, we need another FTE on our team, not less. So there's workload associated with each of these critical work that we're going to have to find a way to absorb what we can. We may have to work with community partners to offload some of it, which we've done with, say, like harm reduction and others, and some that may have to not exist anymore. So those are the hard decisions we'll be looking at for FY28. But again, aligning every decision around that with our mission is how we plan to move forward. Increasing personnel costs are a big one. We talk about this, I think, every year, but on average, our personnel costs increase about 8% year over year. This year, obviously, was much higher given the extenuating circumstances around pay equity and market analysis. But, and obviously, while we support those efforts, that the limiting growth environment makes it difficult to absorb those costs, particularly for programs like public health and IDD. Long-term fiscal issues, Medicaid funding is still, it used to be one of our more stable sources, and now it really, looking ahead, there's so much uncertainty around it, and we're so heavily dependent on Medicaid funding that we're going to be watching all of that very closely, particularly come January when when we have to re-enroll folks every 6 months. That's one of the big ones that we're going to have to see how many people fall off of Medicaid. And I think one thing important to note about that is people may not be able to meet the requirements to go through the eligibility process. It doesn't necessarily mean they're not technically eligible. They just may not remain on their Medicaid as a result of some of the new administrative requirements. And it also doesn't mean that we'll stop serving them. So we're going to be serving the same amount of people, but just not getting paid for it. So that's just a dynamic we'll be figuring out as we go forward. Public health funding, so heavily federally dependent as well. And there's been, we'll have to wait and see how the budget process works out at the federal level. But some of the proposals that have come out, definitely public health takes a very big hit. Crisis program after hours, we'll have a whole slide on it because we can't go through a budget presentation without talking about our stabilization center. But after hours is still one of those uncertain things that we have figured out for, this year, and we'll hopefully continue to figure out. And thankfully to our partners, we're making headway, but it's still one of those areas we need to figure out a long-term sustainable plan for. Client and case acuity continues to rise through the roof, and IDD funding sustainability is a big one, hence why it's on our special request, but also we're working hard at the state level to try and resolve some of these. They're more structural and systemic issues with the IDD budget that we've got to figure out.
Just a question, maybe a comment. You touched on it when you said the Medicaid funding. That's kind of your first entry point in terms of serviceability. As the people fall off of Medicaid, they're falling into deeper, more expensive programs in your that fit in your budget. So you're losing at the Medicaid level really is actually just pushing the problem back down into a deeper pocket, right?
But yes, it will. I mean, a lot of those folks will just go to the emergency room to get care, or they'll come to our crisis center, which is why I think it's going to be even more critical that we remain 24/7 crisis services in the next few years, because it may be the only place many people are able to access when they need it. And it would be cheaper than having them go to the emergency room. So I think there's some strategies in there that we can kind of work through in order to kind of prevent just all of those higher cost care. But also when people delay care, they get sicker. And then they end up in our emergency room, and then they end up in residential facilities and things like that, which are also much more expensive than if they were to have just been in outpatient care.
But I mean, it might be an option at least to look at contract services that are focused primarily on getting people or keeping people enrolled in Medicaid.
Yeah.
Just to get it started. Because again, the higher up the stack that you can keep them, the less cost that's going to get absorbed back on the county and all the other health systems.
That is going to be one of our big strategies going into FY28 is we're already increasing the number of staff who are what's called OHP assisters, who can actually get people enrolled in Medicaid. We're going to be working with our FQHC, our hospital partners, Health Council, many others to figure out as a community how we're going to build up our OHP assister process and make sure that we are all heavily focused on identifying when somebody's at risk for falling off and doing everything possible to keep them on their Medicaid. It's just we do this every 2 years already, to do it every 6 months as we're reducing staffing. And our partners are reducing staffing as well. It's just going to be an extra lift, but we're going to do everything we can because it is critical, not only for the people that we're serving, but for our fiscal outlook.
Mm-hmm.
The function of these OHP assisters is, both strategic for the whole healthcare system and strategic for us.
Mm-hmm.
How do we pay for those?
Yeah. Well, it is a billable service to enroll somebody on Medicaid. So we can, if, as we're getting them enrolled in Medicaid, we can bill for that. So there is a revenue stream. I don't know that I wouldn't say it covers our costs for it all, but it definitely helps.
Well, I don't know how long this increased burden for Medicaid enrollment will last. But if this is a long-standing, persisting thing, then I mean, it does seem like that could conceivably, if we're not recovering our full costs through Medicaid reimbursement, then that might be a important strategic special request in the future.
Right. Yeah, I mean, my hope, and I always look for where there's hope, right, is that the state of Oregon is going to rally together, and they're already working on creating some technology systems that are going to hopefully be able to share with us when people are at risk for that and give us guidance on how to keep people enrolled. So it is going to take state level involvement, and they did receive a lot of staff in the last legislative session to beef up their staffing to address this issue. The challenge right now is they're still waiting on guidance from the federal government, and that's not expected to come until this summer. And these go into effect in January. So they have 6 months to figure it out once they get the guidance. And I just don't anticipate that anybody can pull that off in 6 months. So I think there's going to be a lag, there's going to be a gap. We're going to try to fill that as best we can and as a community. And then I'm hopeful that we'll get some good guidance and support from the state level.
But then don't forget, our health department did an incredible analysis of the redundancy in the system. And we sent that to Salem for perhaps incorporation in what they're doing. And I don't think we've gotten anything accomplished, but we have made the whole state aware of where things could be a lot better. I go to that building and it's basically, there's hardly anybody there. I was at a meeting the other day. It's supposed to be with the commissioners and OHA people. There was not one OHA person in that room. So, you can see, maybe if they were in the room meeting with the commissioners, we might get something more accomplished.
I agree with you. I agree. I think there's room for, it seems like low hanging fruit that we could advocate for, to have people be brought back so that we can collaboratively work together to solve some of these huge problems. I think it's going to be very challenging when we've got a state system that's kind of spread out amongst the entire state, working independently, remotely, and not able to come to the table to kind of hammer out some of these difficult decisions. So I think, to me, it's an easier one to solve, and I think it would make a big difference. But that, and along with many other things.
Just continuing along this idea of this concept of the OHP assisters, the kind of screening you were just talking about, kind of like looking for risk factors for certain people falling off. Is this AI-able?
No, I mean, I'm sure there's some opportunity for AI in there. The challenges with this is that for us, the population we're working with are often houseless. The enrollment process requires documentation, lots and lots of documentation of who you are and what you do and your finances, which when you're houseless, sometimes you don't have all of those documents readily available to you. We're also talking about folks who may be very disorganized or medically fragile. So getting into an office visit to complete this very cumbersome and robust process, it takes hours to enroll somebody. And then sometimes they have to come back because they don't have all the stuff, and then they got to come back again and then finding them. So it's very challenging on a good day to enroll some of these folks on OHP. And now to do it this often, we'll just, there's just going to be some people who are just like, I can't do it. And just, they fall off.
Yeah, I was just homing in on, you mentioned that like a screening process to like detect who's at high risk of falling off. And
well, there's definitely technology that can identify when people are getting ready to need to be re-enrolled. It's more of like the actual process to screen somebody is a lot of asking questions. And so, yes, for some populations, I think there could be a keypad that people run through and are able to quickly answer it. For the population that we're often working with, they need support in filling out those documents.
Yeah, and just confirming, we've been working with our electronic health record program. We have the list. Getting the information of who is not the hard part. It's everything after that.
But we're going to do everything we can because it is very, very important for a number of reasons.
Might be useful to do some scenario planning in terms of where to focus, because there's the heavy lift of trying to get at what you were just referring. There's that next level of people who are home insecure, who very likely, if they fell off the Medicaid rolls, would probably then fall into that next category. And so focusing on that and just trying to, and then you're Paretoing your problem, saying, let me solve this big issue, and then I know that the other side's already going to do costs, and you can project how that's going to impact your other programs.
Right. Yeah.
Homelessness prevention. Yeah. This is absolutely homelessness prevention.
Yeah. Okay.
My camp managers, as it is my understanding.
Getting there.
So our strategy for fiscal year 27, it really is all about staying steady. I've been going around to all the teams within the health department since I took this role. And that's been what I've been telling them is that we are really trying to weather the storm. We are trying to hang on to as much as what we can do as possible. We're going to get creative and innovative, and we're going to, be as efficient in our work as possible. But we are continuing to prioritize our most vulnerable residents. And we are going to continue to break down barriers to access to care through building on our amazing community partnerships, which we're so lucky here in Deschutes County to have the partnerships we do, both internally and externally, to sort of navigate this together, because we cannot do it alone as a health department, that's for sure. We plan to still pursue excellent outcomes. We are a leader in the state in both our public health and our behavioral health service areas, and we do not want to see that be diminished in any way. So while we may not be able to do everything, the things that we're going to do are going to be done well, and we're going to use data and workforce and efficiencies to make sure that we do that and continue to build the resilience necessary to sustain our work into the future. We are still looking ahead and expanding access. We are going to be adding 40 additional residential beds to our community in the next 2 years. So we talked about the 10 adult foster home beds, but we've got 15 child psychiatric 15 bed unit coming online, and we've got a 16 bed secure residential facility for adults coming online. None of that is stopping. And I think that's really important, because we're going to need those resources more than ever as we head into the next few years. So I'm so grateful that the funding came for those facilities when they did, and that we have those projects underway, and that they'll be ready for us by the time some of this stuff is hitting us.
We have the funding to continue to run them.
Yes. Well, I mean, yes. I mean, I won't commit to anything kind of beyond what I have control over. I mean, they are Medicaid part, they're going to be billing Medicaid for those services. They're also going to be billing private insurance and lots of other types of mechanisms. So as long as Medicaid stays strong enough for to support those facilities, I think they will be sustainable. There's not been any talk from the providers that they're concerned that they won't be able to continue to operate them.
No, it's patience.
Patience.
Right? Been here 13 years and look at that. Adding 41 beds.
Yeah, it's pretty incredible. We haven't added this many beds in 20 years. I mean, yeah, it's been 13 years, I definitely haven't seen it, but even prior to my time. So this is really, really big for our community, and I think we will feel it, which is great, and it'll support a lot of people. And then
Funding that we secured was mostly capital funding
yes,
for construction.
Yeah.
I mean, we really didn't secure a lot of funds for the ongoing operations. And so we are heavily dependent upon those operators to have a viable business model.
And they do, these residential facilities are well-oiled machines in a lot of ways. They know they don't go into these businesses lightly without knowing it's going to be viable for them moving forward. The models they create, the challenges that they have to face are really around workforce, and which is kind of tied to capacity. When you have all your beds full, you need a certain staffing level to maintain that. And when all the beds are full, these projects are sustainable. The Medicaid billings make it viable for them. But you can't always be full if you don't have the staffing to support the staffing model. So that's been the challenge, I think, up to this point. But the workforce issues seem to have improved over the last couple of year or two. We've certainly seen it in the health department. So I don't think there's quite as much fear going into these projects as there would have been, say, 5 years ago. We are going to continue to invest in our workforce because we know that that's critical, and they're going to be, everything that we need in order to carry a lot of this forward. Yeah. So moving on, unless there's questions about anything
No, would you mind you were talking about the facilities. Okay, so you switched Wyatt to actually we're buying it.
We're buying it. We bought it.
Okay, but then can you 236, it's on the square footage of Kingwood. Are we utilizing that for which department now? 236.
That's going to be part of I can let anyone else talk about that, but that'll
It's come off of your usage.
come off of our usage, but it will still be, yeah. Eric, do you want to?
Yes, so facilities and property management is working to fill the building. There are a couple departments and a couple of agencies that are interested. There's a domino effect with any types of office moves. So we're working through that, and we'll plan to come to the board soon to let them know where we are.
Okay, so
So it's somebody else's problem, but it's somebody else in the county's problem.
Yes.
Okay, so was Mosaic in 236 or was it in
It
244?
was in 244, and then when they
We're
vacated,
gonna stay in 244.
we're
where
staying in
Mosaic was.
244. Yeah, 244 is being fully utilized, even more so than we ever intended. So with Mosaic moving out, it allowed us to move public health that was in 236 into 244. We also have portions of our IDD department occupying spaces out of 244 as well. So that allowed us to exit the Antler building.
Okay, so Antler's gone. We're not using that anymore?
We are not using that for behavioral health.
Are we selling it?
That would be an Eric question.
Right now, we're looking at moving another department in there. I mean, an option is to sell it, but right now we think it makes sense to keep it. And again, we have probably 4 different entities that we're talking to, and there's a big domino effect. So
How many square footage is in that building? Do you remember?
I don't know.
I know it was kind of interesting. Remember?
Paul,
Okay.
do you remember? Yeah, we don't know.
So another department's gonna go there and then in Kingwood, 236.
Right.
236.
And,
Okay.
and then Mike Meyer, I don't know what the plans are for that either, but I know that's been a hot commodity for a lot of reasons, being in its location downtown.
Childcare,
So, yeah,
really hot.
yeah. So I know that that's a good move for a lot of reasons.
Commissioner, just to verify or to clarify, I think there's a chance that we may have some county departments going into certain spaces and also organizations outside the county that are interested in space. So I think it could be an either or depending on how the sequencing plays out.
Okay.
So along those lines, the building that Pfeiffer purchased from us is, what's the status with that? I mean, is that out of our hands or is it coming back to us? Because it's a shame that not to be proceeding.
So I can't remember what we called it, the one on the corner. Yeah, I don't know. I mean, they purchased it. I'm not sure what
Yeah,
they're,
so that's a clear deal and that's just.
yeah, it's no longer our
Gonna
building.
come back if they're not there anymore, so.
It wouldn't come back to us unless it was a tax foreclosure, but
Yeah.
we sold them the building and
Do we know whether there are other space, like immediately or right near there, whether they owned that or were they leasing that?
Yeah, 'cause they had offices down the street.
Because, now it's a question of like whether that's a block of property that is.
I don't know. I don't know if they owned it or at least there's previous space or current space. I could look up on Dial.
Well, yeah, I just thought there's just the timing wise, if it might have been back. Remember, we don't have the AI added that.
Okay, we can go to next slide. So I want to talk a little bit about some of the highlights that despite all of these challenges that we have been focused on for the last year and the ones coming ahead, there has been some really amazing, incredible work done by our department. And we do want to highlight that, though we're going to move through it quickly because you do have it in your annual report. It starts on page 23. There's lots of robust data in there regarding the work and outcomes that we've produced. But a couple of highlights for public health in particular. I really want to highlight our core mandated program around communicable disease, who responded to 380 communicable disease cases and 629 STI, HIV, and hepatitis cases. Environmental health conducted over 2,700 regulatory visits and 95 pre-opening inspections for food, pool, and lodging businesses. Both of these teams are working quietly behind the scenes, preventing the spread of disease in our community. So really, really important work.
Okay, and then the
Before you go too far off the slide, I
Sure.
just wanted to say, thanks for fighting for healthy schools for 5+ years. 6 years, I guess, because that started before I was on the budget committee. There might be some people in the room that still don't love it, but it is showing results.
It is
And
showing
so-
results. It absolutely is. I mean, they prevented 84 ER visits and the reduction in, suicidal ideation. I mean, it's real. It's a very important, impactful program. And I appreciate, that the support over the years to keep that program going. And it takes a while sometimes to get to the proof of how these programs actually work. And that can be a tough waiting game, but we got there and it's demonstrating success. Thanks for pointing that out.
This highlight, that's just one metric.
That's just one metric. There's a whole bunch more in your annual report. Yeah.
Which, it's one metric that demonstrates profound change.
Yes, absolutely.
Just going back to the earlier question, Pfeiffer does own the property that they operate out of, according to our dial system, which is a fantastic system.
Thanks.
Great.
We won't charge you for that dial
Yeah.
this time. IT discussions from earlier.
Oh, well, you gotta look under every rock, right? On the slide is the public health 5-year forecast. It is a bit difficult to look at, obviously, because fiscal year 28 is we're barely making it in fiscal year 28. What you see in the assumptions here are 5% county general fund limited growth year over year, 8% in terms of internal service fees, averages over the course of 5 years in terms of other revenues. And then if revenue is known to end, we have eliminated it at that point in time. If the FTE is regular, that currently continues in this model. So that obviously would be a discussion and decision points at that point in time. One example would be probably the opioid settlement funds. They were approved on a 5-year period. So that 5 years coming up in fiscal year 28 and is an annual allocation approval process at this time. So those funds are not included in the 5-year forecast. So what could this look like? Here we've got what I am now calling the 3% surprise for public health. And with the latest news around the RHTP funding, perhaps this isn't so far off. So what you see in the green line year over year is 3% surprise, new funding of some sort. So regional health transformation funding, or continuing to leverage, say, Medicaid administrative claims, looking at how the model works, who do we have in it, is it optimized, things of that nature that we're really digging into in terms of efficiencies and leveraging those. Unfortunately, that 3% surprise would not be enough, and we'd have to find continued reductions in cost. What we've modeled here is a reduction in FTE. So something you could consider here would be in fiscal year 28, that represents 3 additional FTE, 2 in 29 and 1 in 30, and then it'd be flat moving forward. Obviously, those savings could come from materials and supplies or other cost-saving measures. And then we would meet our minimum working capital.
I mean, what it says is that you have a path. It's just a very hard path to figure out, and there's a lot of hard work to get there and to make the luck that you need to get those surprises.
Yes. Yeah, and that's why we're doing, I mean, we're knee deep in FY28 budget planning right now. So we've started simultaneously while working on this budget, just because we know we're going to need to do everything possible in FY27 to set us up for success for FY28. So I suspect for the next 3 years, that is going to be how we operate, of always just looking ahead to how we can set ourselves up for success. Okay. So from a behavioral health perspective, also some really amazing accomplishments this year that are highlighted in your annual report. 2 that I want to highlight, or one that Commissioner Chang brought up, which is around in our psychiatric care, our move away from telehealth. We were able to increase psychiatric care in person in South County to 20 hours a week. That may not sound like a lot, but it's huge. We had to get in-person psychiatric care in La Pine has been an ongoing endeavor, and we finally got there, and we are very thrilled, and that provider is incredibly busy. And where it also is tied to just our continued efforts to get out of telehealth contracts altogether, because they're very expensive. It's much cheaper for us to provide it in-house. And I have to give credit to our Board of Commissioners for supporting our creative efforts to hire while still in a contract, but also our medical director, Dr. Sam Murray, and our medical team manager, Chandra Mola, who have done an incredible job really getting out there, recruiting the right type of provider that wants to work in community mental health, which is not every provider, because you can go be a psychiatrist in the community in private practice and make a lot of money and not have to kind of work with the level of acuity that we work with in community mental health. So the providers we have now are committed, passionate providers, and we have the best med team I think we've had in decades.
Just telehealth, though, it doesn't work as well.
It doesn't, not for our population. I mean, there's a place for telehealth. I mean, it does expand access for some people, and there are many people out there that just really wouldn't get care otherwise if they had to leave their home to go do it. Our population, on the other hand, it's very difficult now. I mean, they're often in a homeless camp or don't have the technology or too dysregulated to navigate it. You miss a lot with telehealth. Being in a room with somebody and being able to truly assess their symptom, it's critical that they're in person. So we have long wanted to be out of telehealth contracts for lots of reasons. It's just workforce has been our number one challenge with that.
So great to hear.
It's amazing. We're really, really thrilled.
It's outstanding.
Yeah.
Just going back to that example for a minute, I just want to reemphasize for the budget committee, in this fiscal environment, proposing adding FTE is, it's a big push. I want to compliment health services staff on, making the argument, it's hard to add FTE, A, just because of cost, but B, also because we're concerned about the long-term PERS and benefits and everything else associated with something that's not a contractor. But you made an excellent case for A, how this saves us money, B, how it provides better quality service, and I'd encourage you to keep looking for those, big picture opportunities to advance those things.
Thank you. We appreciate this.
I mean, my take on budgeting has always been there's a start, stop, continue component to any budget process. There's plenty of things that you can start, and even in hard times, there's things that you have to start in order to be able to either find the revenue or solve the problems.
Right.
The stop part is what everybody forgets about. So you're talking about all the things that you're stopping doing, which gives you the ability to go start things that are going to save money, or by starting, it allows you to stop. Just keep focusing on both of those things. And then the continue starts to become a breeze as at least you understand where the fund directions are going.
Absolutely. Thank you. I also just want to take a minute. I cannot, highlight it enough, but our child psychiatric facility, we were able to secure $7.1 million for a 15-bed child psychiatric unit, which will be breaking ground in July and serving youth and families starting in fall of 2027. So again, continuing to move forward with some really important needed projects, despite all the ways in which we're saying no to things right now. Here is our obligatory slide on the stabilization center. we cannot go a presentation without talking about it. It's still our shining star. It is a leader in the state in terms of crisis services. I'm thankful and grateful to say that we are not the only one in the state anymore. That there are 5 or 6 others that we helped get started across the state. There's probably another 6 or 7 underway. So our state is headed in the direction of developing models like this, and I'm proud to say Deschutes County led the way on that effort. We have served over 5,000 unique individuals since opening in 2020, over 20,000 visits. Our law enforcement drop-offs continue to be under 5 minutes. And one important statistic that's not on here that I think is really cool is that our law enforcement drop-offs, we typically, about 26% of the people we served there were brought to us by law enforcement. We have dropped that down to 16%, and that is because we implemented our community crisis response team. So now, instead of law enforcement being the way in which people can get to our facility, we've reduced that by 10%, where now CCRT is able to go out and meet the people where they are and bring them to the facility or get their needs met out in the community.
So is it the law enforcement is bringing less in, or they're just a smaller percentage of what they're bringing in, but those numbers are pretty steady?
They're bringing less people in because they're not having the interactions with them.
Okay, so
Because we have CCRT responding instead of law enforcement. So that's what we want to see. We want to disentangle law enforcement from this work whenever appropriate. And that's what's happening. And the data has been really compelling around that.
thank you.
For some of those people, after their contact with CCRT, coming into the stabilization center.
Times, if they need like 23-hour respite, then that would be something CCRT would transport them over to the stabilization center. We could put them in our respite unit. Sometimes they just really needed to talk to a crisis worker. And instead of having the law enforcement bring them to our facility to have them talk to a crisis worker, we're now heading out there and just avoiding that scenario altogether. So we just, and it's all integrated now. We used to have a mobile team that was separate and a stabilization center, and now it's all one thing. They're all operating out of the stabilization center, both deploying to the community as well as supporting people that walk into our building. So it's a one-stop shop for folks 24/7. We have had 213 people tell us they would have ended their life had we not been open. That's a important number to keep remembering, and thousands of others who've told us that they don't have any idea what they would have done had we not been open. So I think we're really grateful to still be 24/7. As you know, the funding for this program is complicated, to say the least. We do have county financial assistance agreements, so state dollars that come in and help fund a portion of the stabilization center. Opioid settlement dollars, really grateful to the city of Bend and the city of Redmond, and of course Deschutes County for their contributions of opioid dollars to this program. Behavioral Health Resource Network funding, which is becoming less and less stable over the years, is contributing a portion of money. And then the Impacts Grant, which has been our kind of bread and butter for this program, it also took a pretty big hit this year in terms of funding, and that comes through the Oregon Criminal Justice Commission. And of course, what's not on here, because when we created these slides, I wanted to make sure 911 and the Sheriff's Office had a chance to present their budgets before saying that they were giving us money. So now that they have presented, that the money that we've received from them, which totals $225,000, is incredible and very much appreciated.
They told us 150.
It's 150 for the Sheriff's Office and 75,000 for 911. So a total of 225. And that, was just done. They just did that on their own. That was not us coming to them asking, it really was just a recognition of the partnership and the service that we provide that supports their organizations. And I tell you, we feel like one giant team between those two organizations and us. We work seamlessly together, and that's not the case across the state everywhere. So
You did,
This is still not. on the list.
still, St. Charles is still not on the list.
you didn't ask them, but other people asked.
As other people ask. Well, we are grateful regardless of how that all transpired. And I do feel they did it as a result of knowing that they are benefiting from the service and that our citizens are benefiting from the service, and they don't want to see the service go away. We do still have a gap of $2.6 million that we are currently covering with reserve funds. And so that's fine. That works as long as our reserves, stay healthy, as long as Medicaid stays healthy, as long as all the things stay stable. And I think right now that's a concern for us, is because we don't necessarily have confidence in the stability of the funds that are contributing to the reserves or the CCBHC model. And so that gap, I still would love to see a sustainable funding model to help fill that gap.
Isn't CCBHC contributing?
Yeah, it is.
Yes.
But CCBHC is tied to Medicaid. So if Medicaid enrollment goes down, our Medicaid billables go down, our ability to generate revenue in the same way goes down. And then that gap becomes much more difficult to fill.
And the reserves will take us so far. And
Yeah, it'll get us a couple more years. Mm-hmm. And the challenge with the reserves, you have to remember, it's not just filling this gap. It's filling personnel increase gaps. It's filling space need. I mean, it's any gap within the behavioral health side of the health department gets covered with reserves. And those gaps seem to be kind of growing each year. So thankfully we have reserves. We're really grateful for that. And we depend on it for a lot of things.
Well, and you've done a very good job in terms of scaling the outgo so that you can get the CCIT out to the people instead of having to bring them into a physical building. But that physical space does have its limitations as well. So as the need for this grows, which I suspect you think it does, there's going to be some serious constraints that are going to come, given its location and given all, basically just all the things that need to happen in that area.
Yeah. Yeah.
If I could mention one more thing while we're looking at this list of funding and the shortfall for the stabilization center. One of the things you won't see on this list is a county general fund contribution. If you go to in the supplemental materials, you go to the crisis services for Deschutes County Behavioral Health, the general fund investment is zero. While I have been very happy to go to the cities of Bend, the city of Redmond, law enforcement agencies, sheriff's office, St. Charles and everybody else with my tin cup and ask them to support this critical community service that is not necessarily mandated service, but it is, clearly providing so much value to our community. When I ask these people these organizations to contribute, it's very difficult when they turn around and say, well, what is the county putting into it? What health services does to raise funds from all these other places, pursue these grants, work it into our CFAA, everything else. That is a county contribution, but we are not, that's the work of health services. That is not the work of other parts of the county to invest in this critical service. And this is, again, as long as Medicaid doesn't fall apart and we can maintain a reserve, this is, that's one way to close that gap and shore it up. But we cannot depend on that. And there's a continuing need to think about how the county provides core funding for the stabilization center for future budget, for future budget committee years.
But we will keep you all posted on the funding outlooks for all of those various sources and what the future holds for 24/7 operations. It'll be probably a part of every budget presentation we do for a while. Okay, next slide. Cheryl.
Yeah, so a lot of really good conversation about the CCBHC PPS payments as well as behavioral health and the long-term outlook. That's what you're seeing here is the 5-year forecast. And what's incorporated in this particular forecast is both the reserve and the operating fund. In this model, we have assumed that there's a 10% Medicaid enrollment decline. We are hearing anywhere from 10 to 40% for Oregon. So obviously that changes things pretty significantly. Just to give you a sense, if it were to go down to a 40% Medicaid enrollment decline, that changes our financial the resources coming in by about 15 million. So we have 15 million per year less than what you see here. That completely changes the outlook if it were to get to that. But obviously we've got a number of initiatives to that we're working really hard for right now to maintain that Medicaid enrollment in our community. One thing I would say to note, and just to clarify, is how we treat PPS. So when we generate or receive Medicaid through the PPS, we put it into our reserves. We then transfer from our reserves into our operating fund what we need to operate that next year. That allows for some stability rather than fluctuation. We also get PPS much, much later than the time frame in which we are actually providing the service. So that allows, again, just stability. So when we say gap, or we're transferring, say, 18 million into our operating fund, it's not a gap necessarily of 18 million. We are generating revenue through CCBHC PPS that we're putting into our reserves and then using last year's Medicaid PPS to cover this year's need. That's a relatively important distinction, I would say. And so one of the goals that we've been working toward is maintaining, or hopefully maintaining, the amount of PPS that's coming in is the same amount that is going into the reserve. So right now, from an operating perspective, you'll see a transfer in of 18.3 million, I believe it is, from Fund 270 into Fund 274. 16.6 million of that is to cover operating expenses. We think we'll be bringing in 13.6 in PPS. So the gap overall is about 3 million that we're going into our reserve. So All of that to say, this is what the forecast looks like for the 5 years if there's a 10% Medicaid enrollment. We internally have a 20% minimum operating reserve in our behavioral health reserve fund. So we meet minimum contingency levels, but we do dip below the 25% minimum operating reserve with a 10% Medicaid decline.
Gerald, do you have the number of Medicaid people in Deschutes County? Do you have that number at this time?
Yeah, it's about 53,000
53,000.
that is in Deschutes County.
Okay. Because in the state, it's 34% in the state are on Medicaid, 1 out of every 3 people. So, okay, so we are less than that.
Yep.
Okay, thank you.
Okay, on to our special request. So if you had asked me in January how many special requests you thought I might be bringing to this committee, it was definitely going to be more than one. But we have done a lot of hard work, as you've heard about through this presentation, to avoid that scenario. And so we're here today with one special request, and it's related to intellectual and developmental disabilities. And it's really, IDD has just very few levers that they can pull in order to create a balanced budget without some additional support. So I think it's important to ground us in that children and adults with intellectual and developmental disabilities depend on lifelong support to live safely and participate in their community and to experience dignity, belonging, and independence. While we work closely with community partners for some of this work, there are many local families that completely depend on Deschutes County IDD for the only place to turn for these essential services. So this request is to maintain the Intellectual and Developmental Disabilities Program's current service levels of 44.85 FTE through FY27. They have been experiencing a structural funding gap of approximately $760,000, primarily driven by changes in the Oregon Department of Human Services, ODHS, grant revenue, alongside rising personnel costs with wages, benefits, and related increases. So a couple of key things to note with this is that IDD has experienced a 33% increase in clients since 2019. And while the funding has more than doubled over that same time period, there's been changes to the funding that have not allowed us to use it to cover our costs in the way that we need to. So that's kind of like an issue that we need to take up with the state. And we are active. Paul is here. We are actively working with the state to say this is not working the way it's structured. If we're gonna,
It's so crazy.
It's
because
crazy.
I knew their funding actually was one of the few that was decent this last year, but
Yeah.
you're saying that it doesn't work.
It doesn't work. That they need. There's needs
The
to be some-
legislature did something?
There have been changes both at the federal and the state level. For example, IDD used to be a contractor of the state, and as such, we used to be able to include the indirect that is proportional to complete the program. They've limited that over the course of the last couple biennium, but this year that indirect percent is 15.2%. So it highly constricts the amount of funding that we can put towards covering our indirect costs. And that's one of several changes that has been made.
Was that a federal change?
That was a state change.
State change.
Yeah.
Okay.
And so we have been
Yeah.
talking with the state about this and that that something's got to give. Like, the workload model also at the state level is not funded fully. It's funded at 80%. Like it's not the way it's structured right now with the rising increase in clients that are coming in. And remember, these are individuals highly vulnerable that we serve from birth to death. This is not a program in which we serve somebody for a little bit, we transition them out, we bring in new people. The influx continues to come as we serve somebody for their full lifespan. And so the increase is significant at 33%, and we need a functioning model that will help cover all of the costs associated with that if they're going to continue to have the door to IDD services be as wide open as it is right now. There's other options to limit the criteria for which somebody receives services, but those are controversial decisions, and but we need the funding in order to support the population if this is the model that we're going to keep in Oregon. Without the special request, we will have to lay off 3 people in IDD. And this is after eliminating 4 vacant FTE in December, which is about a 13% reduction in their workforce. The positions that are identified for layoff are an IDD specialist 2, which covers adult abuse investigations, admin support tech that covers front desk operations, and a management analyst position. So eliminating these 3 positions would have an immediate and meaningful impact on both the public service as well as the program performance. As you can imagine, fewer adult investigators would leave remaining staff with higher caseloads, increasing the risk of delays and limiting the depth of investigations involving very vulnerable adults. So, I mean, cases that come to our abuse investigators, these are people that are potentially being physically abused, neglected. These are serious investigations that land on our adult abuse investigators to make sure we're keeping this population safe, because they are often the target of bad actors. And so it's really important that we keep our investigations strong. Reduced clerical staffing would create times in which members of the public cannot be served promptly at our office windows. And then eliminating the management analyst position would also remove critical program-specific business intelligence needed to monitor performance, guide decisions, and improve operations. So the management analyst position really specifically monitors whether we're meeting our requirements in order to draw down the maximum amount of funding that we can for the program. So losing a position that's sort of keeping tabs on all that's happening and whether we're meeting our metrics could actually have an additional fiscal impact for us in the future. So our request is for $256,000. It would preserve the 2.5 FTE that are in our budget as layoffs. It would avoid us having to implement mandatory furloughs for the intellectual and developmental disabilities program, which would be different than the rest of our department. And it would also help us leverage local match, which is $1 to every $1.44. Anything I missed, Cheryl?
Can you identify some of those indirect costs for us?
Sure. Yes.
For the public?
Yeah.
They understand what that.
Oh, yeah, that's a great question. We incur internal service fee expenses, and that's to support county administration, IT, finance, all of the things that are necessary to help support the program. Additionally, we have internal supports that are similar. So processing accounts payable, or like processing invoices, helping staff complete their time cards, utility expenses, contracts, yep, anything to help support that particular program to run from an administrative lens. And so those are allocated out to each program based on their proportional share.
And when we can't use state funding to help cover those costs, that really puts a pinch on programs. And we can't do without those services. Those are people often, don't think about all the things that it takes to just, run a county, run a department, run a program. Those types of activities are critical to being able to function, so that we don't have IDD specialist 2s figuring out how to operate and manage a contract. And process a contract, or work with our legal department, or manage personnel matters entirely on their own. Like the HR, legal, finance, all of those pieces are critical to being able to function.
So I just sent Dr. Hoff a text message, like, I think we need to chat. Okay, so
Great.
you ready? Paul.
Great. A couple things that I would add is that the IDD is funded based on a workload model that Holly had referenced. And so usually what they do is they look at the mid-year of the biennium and forecast how much staff our IDD program need to complete what's being asked of them. And so for IDD currently, it's just over 47 FTE. Even maintaining the current level of 44.85 FTE is below what the workload model is saying that we need to do the job. So by eliminating an additional 2.5 FTE puts us even further below the workload model. In the current proposed budget, we also, in addition to budgeted vacancy savings, we heavily utilized furloughs. If the special request is approved, even at the minimum level, we would avoid mandatory furloughs for this particular program, which I think is pretty critical to know. The minimum request that we're asking is 175,000, and that maintains at least one FTE or one position within the 2.5 that's slated for a layoff, and then eliminates the mandatory furloughs.
So no, these are tough. Yes, go ahead.
So I just want to make sure I understand. So 47 full-time employees are for the IDD?
In the workload model.
That's what the state recommends
The state
for,
recommends.
for our
Yep.
population size and for our, what we do as a county.
Okay, do you have how many you apply to homelessness?
For in our behavioral health division, we have 6. We just had some layoffs in there. I'd have to go back and check, but those are specific to obviously behavioral health clients that are experiencing houselessness. So it's not, that's a specific service we provide within behavioral health, but I believe it's,
I don't know off the top of my head. I'm sorry.
do you know, Shannon? We'll find out before we wrap up.
The other thing to know on the
Those
homeless,
are restricted funding sources.
It is restricted funding.
Not-
sources.
Like we
Yep.
can't just move those funds over to IDD.
yeah, we support our homeless outreach services program with a variety of grant funds. So each one of those positions is paid for with restricted funding.
Thank you.
Yeah.
Then because it's IDD, not behavioral health, there's no reserve use.
Right, exactly. We can't use Medicaid dollars. We can't, that's what really puts IDD in a bit of a pickle. Can't leverage some of these, they can't leverage CCBHC, can't leverage reserves, they can't, we can't move funding around within the health department, can't move it from public health or behavioral health to do different things. It really is its own unique funding model that is just not sustainable right now. And we're hopefully working long-term to work on some strategies to make it more sustainable. But we've got a road ahead of us on that.
In IDD,
Did you ask the number of clients for IDD?
I did not.
Oh, the number of clients we
Yeah,
can,
you said it's a third more, but how many?
33% more. Yeah, Paul, do you happen to know? I know you just hit a milestone with that. Yeah. 1,086.
1,086.
Yeah.
It's, we had 8 in our homeless outreach. We have 6 now due to the layoffs.
We have 6 in homeless outreach, to answer your question. Had 8, down to 6 now.
and then is the client load has scaled up in IDD in the last 7 years. Just approximately how much FTE have you added? I think you've reduced over the 7-year period, right?
No, there's been an increase. The workload model actually allows for, funding comes to based on how many FTE are needed. And so over time, we have added FTE according to the workload model. I don't believe, over the 7 years you're referring to, but I think I'll have to check from last year's budget if there was any added. I don't remember.
I mean, a lot of times the question that I ask is when you increase your usually when I say when you double your program, what happens to your costs? Well, you haven't doubled your program, but you've grown it by 33%. But your costs have not gone up 33. Well, your costs have gone
Right.
up, but your overall application of the cost to it has not scaled up at the 33% level. It's less. A lot of the other programs that sometimes we talk about around health aren't fortunate to do that. As the program doubles, the cost could potentially go up 4x.
Right. I mean, I think here for IDD, I mean, the funding has doubled over since 2019, since this increase. I think the challenge is just how the funding's allowed to be utilized.
Right.
And the structural changes that have been made within the program that don't allow it to cover its costs anymore. So it's a bit more nuanced than that. And so the workload model really is intended to increase funding to account for the increased population. But I think, there's some of the things with rising personnel costs as well as the structural changes that just aren't allowing it to work the way it was intended to anymore.
And that's a pretty large increase. Do you attribute that to something?
Paul, I mean, I don't know if you want to speak to that. I have got thoughts, but yeah, come on up.
Oh, I already heard back from her.
No.
She said, did I email Ebony?
Okay.
Well, shall we do that?
We absolutely can.
I think I have Ebony's cell phone.
Okay. I don't think I do either.
Okay. Right.
Remind me of the question.
Why do you think the 33% increase has happened?
Well, I think predominantly we do a fair amount of outreach to make sure that we are that our whole community, regardless of what their language is or where they live, what part of the community, that they know about us and that they get enrolled, because it is while it's a voluntary program, everyone has a right to access our service. And so that's been a part of it. Another part of it is just the population growth in our community. We have stayed apace of that population growth over that time.
Okay. Other questions on the fund request? Okay, and you did throw out a minimum. You said the 256 preserves all of it, but you said 175
Yep.
preserves one of the heads. And which head is it, or is it malleable?
Which position?
Yeah.
I don't think we'll have to make that decision based on what we see, what we get.
That's what I thought,
Yeah.
but I want to make sure of that.
So 175 is the fully loaded cost of one FTE, or there's things associated with that?
Things associated with that. Yeah, we're able to leverage match a little bit more and in a different way with 175,000, because we can put more cost into the local match, which allows us to draw down more on to use towards the indirect, and we can pull in more from the county general fund. So that's part of the lasagna making.
Yes, it's a lot of moving parts with the IDD budget in terms of the match and how it's applied. So yeah, we're filling a $760,000 gap with 200 and
56,000.
Lasagna making.
Lasagna making. And
Layers and layers. And
lots of layers.
Affordable housing developers talk about capital stack.
Yeah,
Just a reminder. for
Lasagna
the-
making is
it's very similar.
A reminder for the budget committee, the special request in the back under special requests on the second page for them, that is option A and option B, where they've broken out the difference between the 256 and the 175. So as we deliberate on that, you can refer to that for additional information as well.
Okay, so I have a question. I just heard from someone who I know is part of this program. She's with the county. Okay, so her case management is with Full Access. So is that a county person?
Yeah, that's one of the community partners, but
Yeah, Full Access is our brokerage service that also provides case management to our population. That is aside from the 1,086 that I quoted in terms of our enrollment. It's another option. I think they have about 300 people enrolled in Full Access High Desert that get case management. They're only available to adults with IDD.
so for youth, the county is.
We're the only door for youth up to 18.
Okay.
But once you turn an adult, you have choice. You have a choice of where you get your case management services. You can choose the county or you can choose one of the brokerages.
Okay, so is this, are the adults in part of our?
Yes. Oh, yes.
They are. So
They-
we're paying for Full Access too?
No.
No, they
don't-
receive different funding from the state.
They,
So this is part of it, the state of Oregon allowing adults to choose where they want to get services. So not necessarily having to have them all come to the county, giving them options of brokerages in the community. It is part of the model in Oregon.
Yeah, that's a lesson that goes back about 20 years to a lawsuit settlement in Oregon that actually allowed folks to have universal access to service and get them off of wait lists. And that's where brokerages got created. It's a much longer story than that, Commissioner. But yeah, Oregon is actually fairly unique as a state that has an option in terms of getting for adults to get case management from a private entity like a brokerage or a community developmental disability program like ours. But the funding is separate from our allocation.
We don't pay full access for their services.
It's direct.
It does, yeah, but it is a state funding model and part of it goes to private entities to provide this case management service.
because her mother thinks she's part of the county's program.
It's confusing for people, I have no doubt.
So.
Yeah.
Getting to the bottom.
Yes, yes. Other questions?
Just acknowledging, thank you very much. I mean, taking this whole big octopus and being able to put it in these slides, being able to talk through it right now, very dynamic times. Thank you for the service level of all the different departments serving the people of Deschutes County. These are challenging financial times, but it's good to know. And, you know, it's very comforting to think, okay, we're already talking about what next year and the year after is going to look like, because that's what's happening. It's just the world we're in right now. Having such a mature organization, be able to bring these 15 and 16 bed units online and being able to hand them off to an operator is a sign of maturity also in our organization. So thank you so much.
Thank you.
It's the note that I had on here is it was something along the lines of, this is a find the Stetson budget, because you do such a good job of saying, I have to be able to figure out how to fund this, and therefore I'm going to go find the money to go do it. And then just tracking that over the last few years has always been entertaining.
I could provide some entertainment.
Get you some popcorn.
I have weird hobbies, sorry. But really do appreciate, everything that you do and the thought that you put into it. And I did make a comment that we were probably going to use the full 2 hours yesterday afternoon, and you're making me look foolish. But you do still have some time. Is there anything else that you'd like to impart on us, or anything that we should be doing as we consider the budget?
No, I know you all have some hard decisions ahead of you as well. I appreciate the opportunity to be here with you all. Happy to answer any questions you might have, even after this, if there's something that comes to mind.
Do still have one question. So a $92 million budget total. How much of that is county general fund? And also just kind of for perspective for everyone, most of the county general fund investment goes into the two smaller divisions of health services. So, the behavioral health, basically, there's no money, no general fund in behavioral health services. But, when we zoom in on the general fund, we can say, oh, well, health services investment is a significant portion of the general fund. But when we look from the perspective of health services and all the services that we're providing and kind of the leadership we're providing at the state level in innovating approaches to taking care of our community, things like Healthy Schools Partnership, things like crisis services. From that perspective, the $92 million, the general fund investment is very small for the service, the value, the benefit that we get in our community for our people.
Yeah. So the fiscal year 27 proposed county general fund is $7,080,632, which is 7.6% of our budget.
Thank you.
Thank you.
I just have a general question, because I think the public might, as you're touching on this, might like to know. So, when you are preparing your budget, because it's got all these different facets from the state, federal, county, do you make the decision to do an additional request and not include this, or is that a county administrator decision to not include the IDD in your budget?
So for this
proposed budget,
for this particular year, because we carved out that 350,000 in the general fund and said that general fund departments could submit a special request. That's why we didn't include it in the budget, because we wanted to leave that decision for the budget committee.
And because it's a general fund. So for example, the road department and solid waste department have their different revenue streams, and they were able to cover those additional costs for their special requests. So I included their FTE requests in their budget, given that there would be no impact on the county's general fund or any other county funding source beyond those that are associated with those departments. One's an enterprise zone, the other through road department, primarily state allocations.
But big picture, when health services is given a 4% limited growth cap,
right?
What you see, out before the special request is basically what they could fit. And then the special request is an opportunity to ask for a little bit beyond that.
Thank you. That's
Thank you.
clarification.
Mhm.
Okay.
All right, any additional questions?
I have a question. So at the Rascal Rodeo, which I've participated in a lot, do you think any of our IDD people were there with any of the youth that they work with?
I don't know. I'd have to make an inquiry
No,
about,
I mean, I just wonder.
yeah, very likely. Yeah.
You think so? Don't you, I mean, nobody said hi or anything, like, I just wondered if they, because I've been doing this quite a few years now, and it's a phenomenal program, and I think you guys have helped with the sponsoring it. It's amazing. So it gives kids such an opportunity to do things that normally they don't get to do.
Yeah, it's a wonderful program.
Well, then you get those kids to Healing Rains or to Crystal Peaks or somewhere else where they can go and get on a horse and, feel, it's an amazing feeling.
Yeah, absolutely.
What,
Just wondered.
Well, I'll say kind of in response to that, we do have staff presence at a lot of community events tied to outreach. We're engaged in 10 or more community outreach and engagement activities a year. Some of them we try to stay in the background, and it's really for the individuals we serve to participate with something like Rascal Rodeo, less than having our kind of faces at an event like that. But there are many that we have a presence at,
So 10 events a year?
at least. Yeah.
Okay.
Go ahead, Phil.
So one more question. I have a sense at the state legislative level of what kind of advocacy we should be doing, maintaining funding for key programs, reduce our administrative burden if there's no new money to be asked for, so at least our money can go farther. But I don't have as good a sense at the federal level. You multiple times, pointed to the federal funding uncertainty that we face, across the board for our various divisions of health services. If there's anything that we should be talking to members of Congress about in the next 6 months to a year,
But have Heather come up here, because I think when I think about that, I think about public health in particular.
what programs are we trying to protect? I mean,
Yeah.
I do have some sense that I'm not happy with the way that that Congress has restricted access to Medicaid and OHP.
Mhm.
I have some sense of that at the meta level, but if there are specific programs
Yeah.
that we depend upon that are on the chopping block or are uncertain, it'd be great to know that.
Yeah, so far, at least on the behavioral health side, CCBHC seems to be holding strong in terms of support from bipartisan support at the federal level, which is wonderful. Again, though, it'll kind of depend on what happens with Medicaid itself and how strong that program remains. But public health, when we think about what's been proposed.
Hi, Heather Keisner, Public Health Director, for the record. I would say, though, when it comes to behavioral health and substance use prevention and all of the prevention work with SAMHSA, that is definitely under scrutiny right now and a potential threat for funding. And then in the public health world, I would say a lot of our kind of core work that we do around STI prevention, HIV prevention, communicable disease, emergency preparedness, lots of uncertainty around kind of funding around that. And there's just a lot of shifting happening or potential shifting. It actually hasn't. I mean, we've been nervous about this for the last year. And so far we've been in a stagnant budget, I guess, a continuing resolution. So we're just watching it closely to see what happens. And, we work closely with OHA and our federal partners as far as advocating. I'm on the Coalition of Local Health Officials and the State Public Health Advisory Board. So on that level, but I think we're just kind of watching. Last year, WIC was kind of part of, unfortunately, the government shutdown, and their grant kind of ended at the same time that the government shut down. So we had a lot of uncertainty around Women Infant and Children program. That was fully funded for the year. So that was great to see. Yeah, there's just kind of a lot of uncertainty right now.
WIC is not part of the Farm Bill.
No, I don't believe so.
SNAP is.
Yeah,
Farm Bill.
yeah, and WIC is part of part of Department of Ag, but it's separate from SNAP. Mhm.
And when you were, there was a moment where you were talking about, STI, HIV, and then preparedness. Was that in relation to STI?
No, emergency
Preparedness is-
preparedness and FEMA and all of that there's just a lot of unknown at this point. And what kind of could potentially be cut at the federal level that then gets pushed to the state level, and then you kind of reference the state budget and the challenges around the state budget, and then how that hits local. So I kind of see it sometimes as a double whammy, right? Because we get a lot of public health is federally funded, but it passes through the state, through state grants. And so that's kind of our program elements. So, we're funded really in a lot of different ways. And I want to really focus on how do we continue to diversify that funding so we're not reliant on, just one stream.
And I think prevention is something we've been talking about for many years, of just the dwindling funding that supports that program, and so much focus on the higher acuity, which is easy to understand. I mean, the acuity has been rising for our populations a lot, and and behavioral health, we get very focused on aid and assist and some of those really high level services, but we forget that prevention services could really help solve this problem if we could get ahead of it. But instead, we funnel all the money towards the back end. And so we need to spend a little more time on the front end. We've been advocating at the legislature for more prevention dollars, and it just hasn't gotten traction. So I would ask for your support in continuing to advocate for prevention services, really focusing on youth, and allowing us to get ahead of this.
And again, it's address it at the top
Yeah.
level, and it gets much less expensive than having to address it
Exactly.
deeper and deeper down.
Yeah.
And as we head into the state legislative session, I would say, you hear me talk about it all the time, but public health modernization is another huge piece that we can't have that get cut, because that supports a lot of the work that we do.
And when you say prevention, there was a mention of SAMHSA. Is that primarily is that primarily about substance use, or is that broader prevention?
It's also suicide
prevention. Yeah.
Is another big grant from the feds. Mm-hmm. Mm-hmm.
Which, we definitely need to keep a heavy focus on that for our community.
Yeah, and I would just add, going back to the slides in the beginning, the core public health work we do, when I look at communicable disease response, preparedness, environmental health, we have to do those no matter what. I mean, that is a mandated, required role of a local public health authority. And so I just want to give a shout out to those teams, because they have not grown. We have in some areas shrunk, and but we continue to have a growing population. And as you all know, you never know when a communicable disease is going to hit us. And there's a lot of work being done behind the scenes when it comes to a lot of different things. I look at measles right now, right? We haven't had a case, but there's been a ton of work to prepare for that. So I just always like to kind of focus in on the things that you necessarily don't see that are happening.
Prevention is hard to measure.
Mm-hmm.
All right. Any additional questions? Really appreciate all the work that you do for the county, and all the work and preparation that you do when preparing the budget and presenting it to us. Thank you for that.
Thank you.
All right. We will take let's do a 15-minute break. Man, you're going to think I'm just generous today.
Oh, generous.
I almost said 16, but we're going to go with 15. We will reconvene at 43, or I'm sorry. Yeah, at 10:43, and then we'll see. We've got our next two departments that are reporting are both coming in, so we might get lucky and they come in early, or we'll have a little bit of time to talk.
Nicole from OSU said that they can be here by 10:30.
Back.
Yeah.
Hey, everybody.
Over here.
It was remarked in the break by somebody that, wait, a government meeting's ahead of time? And so the answer is yes, a government meeting is ahead of time. Welcome back. Yeah. We won't now. It's, if it is going well, then I will give credit to everybody else. And if it's going badly, I'll take the blame. That's my buddy Will, who I helped celebrate his 80th birthday just last weekend. Was always fond of giving credit to the people who actually do the work. So, and that is the committee. So, and the staff. So we are back. Again, we are a little ahead of schedule here, and we will be moving on to the Deschutes County Extension and 4-H District. So I will open the public meeting of the Deschutes County Extension and 4-H District. Why don't you do introductions up front, and then I'll take care of some things.
Morning, administrators and commissioners. My name is Dan Denning. I'm the Water Conservation Manager for the City of Bend Water Services Department.
And you're on the end.
And I am on the advisory board for the OSU Extension.
And my name is Nancy Glick. I've been a master gardener since 2006, and I'm on the advisory commission also.
Is it time to plant yet?
No.
It's time to start your seeds. but
In Sun River,
the
it's not-
garden, yeah.
I know, I was doing something in my house.
Yep.
Who's off of Black Butte?
Inside.
We'd appreciate it if you did it slowly too.
Yeah.
Oh, yeah, water, yeah.
I don't know, horticulture, the nurseries would be thrilled if you planted right now.
Good
Go ahead,
morning,
Nancy.
everybody. Nicole Strong. I'm the Regional Director for OSU Extension and the OSU Budget Authority for this.
All right. And at this time, I will open for public comment. Is there any public comment in the room? Seeing none, is there a public comment online? All right. I do have one piece of public comment. We were sent an email from, and I might butcher the name, Kessie Cavallaro. That will be included in the record. I don't believe that we need to read it here. But it was about the elimination of a potential position, and I'm sure that's something that you'll address in the in your meeting. Otherwise, go ahead and take it away.
Thank you. Extension has always been a cooperative effort. We receive federal funding from capacity grants. We receive state funding from the Oregon Statewides package, which includes extension service, forest research laboratories, and ag experiment stations. And we receive local funding, namely through county governments and one tribal government. And those either come through service districts like Deschutes County's tax service district or general fund allocations. Our mission is to assess and understand the relevant needs of each community and use best available science to help meet those through education, facilitation, and other empowering strategies. We have several programs in Deschutes County that we offer: 4-H Positive Youth Development, Crops and Forage, Forestry and Fire, Family and Community Health, Home Horticulture and Master Gardener, our Juntos and Open Campus programs, and we have Livestock and Range presence here. A little quick program update of everything our folks have been up to in the last year. We hired Morgan Henson as our 4-H faculty she started the week of fair in 2025, just right into the deep end. We have about 700 club members and over 100 volunteers. We had a great fair last year, a really strong horse group of kiddos this year, highlight a national leadership. We do high desert leadership retreat and STEM classes and day camps. We have had to make an FTE adjustment in the budget. If you recall last year, Commissioner Chang pointed out that we were consuming a lot of carryover last fiscal year and that it wasn't sustainable. We hired a second 4-H education program assistant in 2023 to carry some of the gap that we were experiencing with turnover of faculty. We have really strong faculty in place right now, and I went through the budget with
my finance director with our advisory board, and we determined that we just can't sustain 2 educational program assistants. We still will have 1 full-time education program assistant supporting the 4-H faculty, and we have half of an administrative program assistant. There's a lot of paperwork in 4-H, so that position's really key. Would I like to have 2 full-time education program assistants for the geography and population of Deschutes County? Absolutely, but we can't do that and put the service district into debt. So that is the decision we've made at this time. If anybody wants to fund a recurring education program assistant, I'm happy to send those numbers. Do I ask for questions now, or do we want to wait?
You can, I mean, we're usually an unruly crowd. We'll ask the
Okay.
to us, but
Okay.
feel free to continue on your presentation.
All right. You may have noticed that we had a warm, dry winter. So the alfalfa weevils are really happy with that. So Gordon Jones, our crops and forage faculty, he is out there collecting weevils, counting weevils, and looking at different management strategies. There's a resistance to past treatment options. And so he's looking at some emerging other products that can be used for alfalfa weevil management. Gordon also hosted a regional forage production and pasture symposium. I think there are several hundred people there. He's doing a lot of work on irrigation efficiency and drought resilience of different forage pasture types. And I don't want to mess up, but he has a really cool variety trial with different varieties of pasture, different irrigation regimes. He is covering all the bases, and then we'll release that in a forage publication and education opportunity. Scott Dugan, our livestock faculty, has been putting on an annual calving school, which is really successful in helping people be more successful in the calving enterprise. And he plays an important role in wolf depredation committees, bringing objective science. Community horticulture and master gardener. I'm going to take a little break and let both of my advisory members work in that sphere. So I'm going to pass the baton to Nancy to talk about this.
Hi, good morning. With the financial support of the Deschutes County Commissioners, every year the Master Gardener certified volunteers carry the OSU Extension horticulture vision into the Deschutes County by managing 3 demonstration gardens, a community garden, a horticulture help desk from April to October. We teach sustainable gardening and we maintain a website which has gardening information for the public's use. In the past fiscal year, our free walk-in help desk, which is known as Plant Clinic, and an OSU Extension online program called Ask Extension, with the knowledgeable extension staff, solved the problems of 614 Deschutes County gardeners. The 3 demonstration gardens and the community garden last year donated over 1,300 pounds of fruit and vegetables to the local food bank. Our website has had 6,000 visitors, and every year, almost 600 home gardeners attend our growing vegetable classes in the Bend, Redmond, and Sisters area. Several years of free gardening classes are also on our website and the Central Oregon Master Gardeners YouTube channel, all free, of course. In 2025, the OSU Horticulture Program hosted 53 events for local gardeners. Our Master Gardener Coordinator, OSU Professor Detweiler, has calculated that the program volunteers reached almost 2,500 people in 7,000 volunteer hours, valued at more than $250,000 or a 3.14 FTE. We teach gardeners landscaping sustainability with fire-resistant and native plants, water conservation, building pollinator gardens, and growing healthy, pesticide-free fruit and vegetables. In the words of our former state coordinator, OSU Professor Langolato, gardeners will save the world. And with your financial support, we can do that. Thank you very much.
Thank you.
Thanks, Nancy.
Good morning, everyone. Today, I'm here to highlight the role of OSU Extension their horticulture program and Master Gardener program, and the longstanding partnership that they've had with the City of Bend Water Services Department. It's no surprise that this year's drought underscores the need for water management practices to secure water reliability in our high desert communities. And with the snowpack becoming more variable, water demands increasing in our urban areas, conservation still remains one of the most cost-effective practices and strategies we have available. Since outdoor water use continues to make up a majority of urban municipalities' water consumption in Central Oregon, 60% here in Bend, the expertise provided by the OSU's horticultural staff and master gardeners on regionally appropriate plants, drought-tolerant landscapes, and efficient irrigation practices is critical as we continue reducing our per capita water consumption in our cities. This is across the board in our region, while keeping pace with the rapid development we're experiencing and cities' aging infrastructure. So for decades, the partnership with OSU Extension and the City of Bend has delivered community education and research tailored to the unique needs of the Cascades. We are very different than our counterparts and our peers in the Valley. Continued and increased investment will ensure we can meet these emerging challenges and emergency situations we are in. Now entering its 6th year, the WaterWise Field Day is a strong example of this collaboration in action. The event, which now draws an average of about 300 community members at Holland's Head Park, began as and continues to be a joint effort between the Master Gardener program and the City of Bend's Water Conservation program. It remains a popular hands-on learning opportunity and showcases the demonstration garden we built in collaboration in 2017. I encourage you, if you haven't been, to join us June 13th at Holland's Head Park to see firsthand the impact and community value of this partnership. I just want to express today that not only is this a regional and a City of Bend and OSU Extension partnership, but this is part of a broader relationship we have with Deschutes County Soil and Water Conservation District, with the City of Redmond. This is a very important program and source of outreach for our cities and counties. Thank you.
Thank you. So what was it, June
June 13th, Saturday, June 13th.
13th is the WaterWise event in Holland's Head, and July 18th is our annual High Desert Garden Tour this year in the Redmond area. Family and community health, ask a health person and they can turn any issue into a health issue. Our folks are working on emergency preparedness, food security, safe food preservation, hygiene, high-speed hand washing. They're doing that in the schools. They're working on agri-stress, that's mental health for our agriculture, ranching, and fisheries communities. They are also working in partnership with our fire team on some smoke mitigation. I do want to highlight that SNAP Ed, the education portion of the SNAP program was sunset September 30th of 2025, which resulted in a loss of 3.0 FTE in Deschutes County. We had a person based out of Lapine and 2 folks out of the Redmond office who were cut due to that. Forestry and fire, our folks help with prescribed fire training, post-fire, a lot of post-fire recovery and restoration work after last year's fires. They help write fire protection plans. They work in the forest collaborative space, which is how I've met many of you from my past role. There's a lot of demand for learning more about juniper. Even the juniper are drought stressed right now, and we're experiencing mortality. And they have a lot of different audience, from urban tree issues to landowners to different stakeholders. And our Juntos and Open Campus program, they work on a lot of career, technical, and college readiness programming. Kids of all kids in all schools, but they also do some targeted work through the Juntos program for our Latino kids. They recently put on the La Chispa, which means the spark event in the Redmond School District. The middle school kids got to go to high school for the day and do a lot of leadership and team building. And then we also take entire families to different universities to experience campus and reduce maybe some of the barrier through intimidation. This year we went to OSU Cascades. And our Juntos coordinator, Emily Chavez Romero, plays a key role in the Bend Dia de los Muertos event, which is an important cultural event. Okay, budget time. We have our payroll and support at 536,000, audit fees, 56,000. I appreciate the new transparent formula and description is really helpful. And I should back up and say the finance team at Deschutes County is wonderful. And they've been really supportive and helpful as I play the role of budget builder and administrative office manager because we've had a vacancy. So thank you for your patience and for answering all my questions. Is not all departments are like that. You have a really special team. We have our materials and services at 101,000. We're still paying for our second building. I understand that to be payment 9 of 18. Please correct me if that is wrong. And we have a contingency this year of 254,000. And then we have our resources and our projected carryover, which we'll get a more accurate sense of that probably in August or September. So we don't plan on spending much of end balance this next year with those reductions that we discussed prior.
You're basically keeping yourself flat.
We're keeping ourselves flat. I've been told in other service district counties to plan for 5.5 months of end balance because of tax collection, or if something were to go sideways. I'm open. I follow the guidance of the budget committee and the county commissioners. I have one county that wants 1 year of operating budget and ending fund balance. So I will work towards whatever you tell me to work towards.
You're doing fine.
Thank you. If you're more of a visual learner, this is kind of how it parses out. And then challenges and future initiatives, as we spoke about earlier, we've had to make reductions and the population and needs are growing. Probably you hear that from every department. So for us, that means I don't want my people to fill gaps because that's when we get burnout. I mean, with their existing, I don't want them to do 3 jobs, right? That's not good for them. It's not good for us. So we're going to have to prioritize and choose some initiatives over others. And so I'll work with my team on that. And then I'm really excited that y'all have a new Fair and Expo director. Jeff and I got together and talked about where our goals align and where we're going to just have to be really good communicators and teammates and neighbors. So I feel really good about that. And we're still working on getting a written agreement signed by everyone. So hopefully this will not be on this slide next year. And that is all I have for you. I open this. Thank you for your support. Again, the finance team, thank you so much. Hopefully I'll be less needy next year. And open to any questions or comments.
Right? Questions for 4-H?
So just for clarity, the 788 number is the tax base, it's being transferred. And then that's the function of getting to November already in there, and the contingency on top of that is just the other funds that could be rolled into that.
Right.
Mm-hmm.
That's what I'm seeing.
Yes. Yes.
Well, you mentioned at the beginning of your presentation, the federal funding stream and the state funding stream. So in the financials you've presented, this is just for the taxing district.
This is just the tax district.
That is kind of separating out those federal and state monies.
Yeah, the federal and state funds pay for faculty salaries and our internal services. So human resources, IT, communications, administration. Those are all covered through federal and state dollars. And the service district operating budget pays for the physical space, our computers, travel, and support staff.
All right. Any additional questions? If not, there is a motion included in the packet, and I would entertain somebody to motion that.
Approve Deschutes County Extension and 4-H Service District budget of $1,088,737 and set the tax rate at 0.0224 per 1,000 of assessed valuation.
Second.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor? Aye. Any opposed? Any abstentions? Motion passes. Congratulations. You have a budget.
Thank you so much.
All right.
So
Thank
good to
you.
see you all.
Thank you all.
All right. This time I will close the 4-H meeting. And we will, we'll have Sun River Service District come up. I will open the public meeting, and while they're coming up and getting set up, we'll get moving on that. Like I said, a little housekeeping, as I am a member of the Sun River Service District Board and have been privy to the generation of the budget, I will abstain from any deliberation on the budget or any vote on the budget. Just letting everybody know. I am available to the service district as a resource if they need to answer questions. And just a little bit of preamble on that. One of the things that the Sun River Service District Managing Board prides itself on is that we hire excellent staff and we let them do their job. And they also hire and maintain excellent staff. We have Administrator Holiday up front. I see Chief Boos is off on a family matter, and Chief Rassick is in Washington, D.C., actually at the enshrinement of one of his former officers at a law enforcement memorial. Which reminds all of us in the district that public safety is a very dangerous and thing, and it's something that we do not take lightly in terms of supervising our police and fire. So I appreciate that. I will now let them take it away and probably won't have to say anything. Take it, go for it.
Thanks, Jim. Hello, everyone. Administrator Holiday, and then I'm joined by Lieutenant Van Meter and Deputy Chief Bjorvik here. And so we'll be presenting on our fiscal year 27 budget. District accomplishments, there was just too many to include into one slide, but these are, the top ones. The first one is Lieutenant Van Meter graduated from the National FBI Academy this year. So that was quite an accomplishment for our district. Once again, we were certified by the Northwest Accreditation Alliance. The drone program was on a pause for about a year due to staff moving on to other avenues. And so we were able to get that reestablished. And now we actually have 2 pilots in training for that. Police Chief Rassick served as the chair of the Central Oregon Law Enforcement System, which is cool. So that was great for him being new in the area and really was able to get to know the other chiefs in our Central Oregon law enforcement group. We also have a police officer selected for the Central Oregon Emergency Response Team, the CERT team. And in fact, I've been working with Cam and Dan on a 7/16 budget adjustment that we'll be bringing to the commissioners in a couple weeks due to a couple items that he needs to be outfitted for that program. So night vision goggles and other cool stuff. So we'll be seeing you again in a couple weeks for that. We provided conflagration fire assistance. You'll see one of those pictures. That was actually for the flat fire last year. Deputy Chief Bjorvik serves on 2 federal incident management teams. We also had a firefighter, Kevin Fern, selected for the Deschutes County SWAT team. And we are a member of the the Central Oregon Special Rescue Team. And then the ones that we really pride ourselves on are the numerous community events that we participate. There is one more that I'd like to add as part of Chief Rassick being in DC. We have Corporal Liz Lawrence in DC as part of the Unity Tour, which is a bike tour. She does a couple hundred miles, I think, on the bike for the tour, and that's to raise money for the Fallen Officers Memorial. So we've been posting some photos to our social media if you want to look at that. So for 7/15, our budget summary, that's our operations budget. So for resources, our tax revenue growth is projected at about 3.38%, which is just shows some of, we'll get into later, some of the concerns that we're having is that we're built out, Sun River's built out. So there's not a lot of movement with that property growth with the taxes for that. And then other forms of revenue have stayed pretty consistent. However, I have a feeling Deputy Chief Bjorvik will be very busy this summer with conflicts. So we might be able to have some wiggle room there with some of those reimbursements. With requirements, as everybody, and you guys have probably heard over the last couple of days, the various increases that are outside of our control we're having to work with, which is workers' comp, property, and health insurance increases. That's why one of the things I'm looking into, and Cam's been helpful with me getting information on, okay, a couple years ago, we looked at potentially moving on to the Deschutes County Health Insurance Program. Should we revisit that? What are the numbers? And just kind of looking through that. So that's that we were kind of looking at. I'm not sure if that's the direction we'll go, but just looking at any areas where we can save money. The reserve fund contribution, once again, been working with the finance team, which I'll reiterate, just like the 4-H group did, that it's a fantastic team and sure appreciate all your guys' help. We do have a surplus at the end of fiscal year 26. That's been due to some previous tax overpayments that we were able to find out through the previous group that was doing our HR and payroll, as well as conflagration reimbursements, and then refunded through ORS 181. And that's where if we have a police officer that goes to the academy and within the first 3 years, if they move to another agency, there's the tiered system to be reimbursed for that we got those funds. So all that to be said is that we do have quite a surplus because of those unexpected revenues that we're looking to use as a reserve fund contribution, and working with Dan and Cam on setting that up for next, after the audit is complete in December, the mid-year adjustment, to be able to show that. In addition, we are also currently in negotiations with SROA. We provide, have been for many years, their rules and regulations support, but at the time of the budget, we weren't kind of sure how that's going to go. So Bike Patrol wasn't in the budget because they actually pay for that service. And so through the discussions we've been having, we have a joint meeting tomorrow morning. It looks like we'll be moving forward. So that'll be once again wrapped into that budget adjustment next fall to show the Bike Patrol that we hope to have on for this summer. Let's see. We are ongoing with CBA negotiations with police, but we have completed fire. It does show a budget deficit when you look at our 715, but we've already found with one staff vacancy that left earlier than expected because she got a great opportunity over at Crook County, and then also some contract renegotiations. We're already looking at about 35,000 that we've been able to add back in. So there is a budget deficit there, but we have some that we can offset already. Moving forward to 716, that's our reserve budget. So, and I have Lieutenant and Deputy Chief here if anybody has any questions, but for fire, they're looking to replace a vehicle and then 2 life packs, which you'll see in the picture there on top. And then we're ordering a replacement ambulance that I believe we've been putting off for quite a few years. It's not expected to arrive for a year or two just because of that's how behind they are with those orders. However, my luck would be it'd show up on June 30th, 2027. So we're putting in the budget just in case, but payment will probably not be till the next fiscal year. For police, they're needing to replace 2 vehicles. As you can imagine, they put a lot of miles on their vehicles. And then also we're purchasing a new Genesis LRAD. Lieutenant, did you want to speak just a little bit about that system and the partnerships that we're looking to have with that?
Sure, I'd love to. This is LRAD stands for Long Range Acoustic Device. It's critical in being able to project orders very long distances. In a crowd control situation, be it an evacuation or a unlawful assembly, it's critically important that there's a human in the loop that can give you direction, speed, and distance from an evacuation or a crowd control perspective. Is incredibly high liability. I'm also one of your divers on the county search and rescue dive team. And so, for example, on a dive rescue like we had in Dillon Falls last summer, there was a lot of crowd that was alongside trying to help, and it would have been so beneficial for our team to have this type of device to control the hundreds of people that showed up to search and help us search. So that communication, I think, is really important for also the dive team, for the police department, for the fire department, and anybody in the Tri-County area that needs this type of mass communication with the human in the loop. We would really like to have this piece of gear.
That's a PA system or communication.
Yes, sir. It's a PA system on steroids.
And it can be affixed to a vehicle, right?
Yes.
Okay, moving on to 717. So that is the fund that we created for the public safety building, many of which I think most of you have been to at least a couple of times. The majority of the spending is complete, so there's not as much going in and out of that fund this year. There's just a couple deferred projects. We do have them currently budgeted for fiscal year 26, but due to construction and how things kind of sometimes lag, we're budgeting it as well for fiscal year 27, just in case it moves over to the next fiscal year. But the amount of need out of that fund has greatly diminished, and basically it'll move on to just increasing as part of a reserve fund for the building, and then also to pay the debt service. It's kind of a minimal amount of transactions this next year we're anticipating, as we would hope with a brand new building.
Any last kind of like punch list item, an elevator or a door or what?
Yes, we have the south apron. I don't know if you want to go in a little detail on that and the other items.
Paving you're referring to as the apron?
Yes. Mm-hmm.
And drainage, adding a dry well, extending some curbing, repaving that apron that got water line trenched through during initial construction. So getting that tightened up.
For all the water running by your shoes.
Yeah, we just happened to be there one day when there was
Yeah.
water flow test, and like, oh, that's not.
So fiscal issues. So short term, like I talked about, the property tax growth is very limited in Sun River. We are built out. We're already at our max mill rate at 345, but we do have an SSD finance committee that is looking at these issues and meeting to try to figure out a solution to these short-term issues. In addition, we're still bargaining with one labor union, so we're hoping to wrap that up pretty soon. And then determining the new building maintenance and reserve needs. So like I said, we're working on a reserve study. We have combined a reserve study. It's one reserve study, but it has two pieces. One is for the capital reserve portion, but then also there's another piece for the building. So we're working on that and starting to save in that 717 fund for that reserve, those reserve needs. Long-term fiscal issues, once again, the growth rate, and then upcoming high dollar capital needs. So for instance, the ambulance, the ladder truck, we're always needing a couple vehicles for police every year. Those are not getting cheaper every year. So we just have some big ticket items coming up. And then also just maintaining service levels as overall costs increase. So that's our goal. Future initiatives. We're actively researching cost reduction and contracts. Like I said, the health insurance, just trying to look at different areas that we can see if there's any way to reduce some of our expenses. Like I mentioned, the reserve study already is including the new building and the equipment. The finance committee and the chiefs and I were looking at different ways to increase district revenue, ongoing retention and recruitment. One way to save money is it's very expensive to retain, or to have new staff, that turnover, right? To get them up to speed. So especially with our police department, we're working with Chief Rossick and Lieutenant Van Meter on a recruitment and retention, ways that we can keep people longer before, they might want to move to different areas. But with that being said, re-examining staffing levels. Is there any way that we can move some of those pieces to try to save costs considering the budget constraints that we have this year? And with that being said, here's a picture of our group, well, at least some of them in front of the new building. So I'm sure they're all happy that I chose that photo. So
Questions for the service district?
yes, any question?
Maybe more of a comment than a question, but when the Black Butte Ranch Service District came through earlier this week, they talked about opportunities to expand their assessed property tax base through people doing additions and major remodels, and basically making, if you can't build more houses, you can make the houses you have more valuable. So I was wondering, I was wondering if you were seeing any of that in Sun River, and if not, then maybe you can have one of those Home and Garden or some fancy publication come through and give people some ideas for how they.
Yeah, right.
they could, level up their houses.
Interesting. Okay, so Black Butte Police Department brought that in?
That was, yeah.
Yeah, okay.
Yeah, I mean, I was surprised to hear that because, I just think of, a long-established resort communities,
Yep.
kind of what's there is what's there, but they said there were people who were, again, leveling up their houses, so.
Interesting. Okay, thank you.
All right. Additional other questions or comments? If not, at this time, I'll open up for public comment. Is there any public comment in the room? Seeing none, is there any public comment online? Seeing none, we can move. There are 3 motions that are necessary here. I would entertain a motion on the first.
Approve Sun River Service District budget of $11,448,160 and set a tax rate of 3.4500 per 1,000 of assessed valuation.
Second.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor? Any opposed? 1 abstention. Motion passes. There is a second motion.
Approve Sun River Service District reserve budget of $3,261,015.
Second.
We have a motion and a second. Is there any further discussion? If not, I'll call for the vote. All in favor?
Aye.
Any opposed? 1 abstention. Motion passes. And a third motion.
Approve Sun River Service District capital budget of $1,189,941 and set local option capital improvement tax rate at 47 cents per thousand of assessed valuation.
A second.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor?
Aye.
Any opposed? 1 abstention. Motion passes. Congratulations, Sun River Service District. have a
Thank
vote.
you, everybody.
I will note that all 3 of your governing board made the motions. That was
Yes, that's lovely. Thank
you.
you.
Partnership there.
all right. And thank you very much for your time. And, I should say to all the staff, you're doing a great job.
So.
All right. All right, we will move on. We have somewhere in the range of 45 minutes before lunch. And so we had discussed yesterday about moving up the special requests. Is everybody still good with that? All right, special requests are found in your supplemental section. They're right up front there. Is there anything we'd want to talk about before we got into?
So I think USDA is online right now to
Okay.
answer any questions regarding their services.
Okay. I see a Brian Thomas online. We got two Brian Thomases. Why don't you introduce the two of yourselves and we'll go from there.
Good morning. I'm Brian Thomas, District Supervisor for USDA Wildlife Services. And this is Matt Alex, my assistant.
Morning, folks.
All right. And this is regarding the contract that the Forest Service has currently with solid waste and with the county on wildlife services. So
There you go. Yes.
why don't you give us an overview of how you view the contract, and then we can ask questions from there.
Okay, I'll give you a little background, and I'll have Matt go over maybe some of the more financial into things. So Wildlife Services, we work in contract with the county. We work in conjunction with ODF&W and the Department of Ag and the county, providing assistance with wildlife issues throughout the county to whatever request that might be. We do most of the bear and lion complaints that come through ODF&W throughout all the counties that we service. We've had a program in Deschutes County since, I believe, the late 90s is when we first started our program there. And I actually was the person who started that project way back then. That was predominantly working with starling issues out at the Knott Road landfill. And then it's morphed from that into what is now a a full-blown wildlife services program, which we deal with, whatever complaints come our way, through whatever avenues, whether that's from the commission, from the county, from ODF&W, or other entities throughout the county. We deal with not only the funding that we were requesting from the county, but we also receive funds from some of the private entities that we work with, the larger entities that we work with. Usually we go after private contracts with them to offset the cost to the county. So, that help at all?
Yeah, I think that's great to know. What kind of questions do we have for Wildlife Services?
So I'll just acknowledge this is Commissioner DeBonne, and I do appreciate what you've done. We've made a relationship a little bit over the years here, and the not landfill, starling population management is the foundation of this. But also we've seen coyote pack management and other rodents and agricultural effects. So for us at this board level, it really is the concept of do we take either general fund or other resources of Deschutes County proper to commit and be a partner here. Yesterday we talked about having you here, and then I asked the public members to share thoughts on this. So this is a change, having it come from the solid waste budget to splitting it with solid waste. So just setting the table for what the discussion is right now. There.
I have a question about when you get a call for service, how do you determine who to charge? How do you know if it falls within the current contract with Deschutes County? And when do you decide to charge the entity that calls for the service?
Okay, that's a good question. So it depends on what the animal is that's causing damage. Like I said, if it's bear or cougar, then that ends up going out of ODF&W funds. And then a great deal of it is where that party might be. Like if it's inside the cities, we do contract with some of the cities or the functions within the cities, like the cities, the bus barns,
Park and Rec Department,
Parks and Recs, and so forth like that. If it's private citizens, if it's somebody within the county that's having issues with a coyote problem, then that gets billed back to the county.
I can provide a little bit of context. Over the last year, for example, we worked 102 properties in Deschutes County. We worked 80 of those under the umbrella of the county or solid waste funding. We worked another 22 that where we have private, separate financial agreements with folks. And like Brian mentioned, these are golf courses, Park and Rec Department. It's city-based work that we do, work for the school district. And right now we have 2 full-time employees in Deschutes County that cover both the work that's done under the county umbrella and with other, direct financial agreements with other entities. We cover a wide range of species in the counties: rodents, birds, small mammals, predators, deal with bear, cougar, coyote, wolf issues with public safety. As Brian mentioned, usually that's in conjunction with ODF&W and law enforcement when there's a threat to the public or their pets. Those are intermittent and kind of unplanned, but happen in Deschutes County and throughout Oregon. We protect a lot of resources throughout the county. We deal with livestock protection, all different kinds of livestock: cattle, sheep, horses, llama, poultry from different predators, damage to buildings, dikes and impoundments, all golf courses, of course, working at the landfill, utilities, damage to other ag products and fields and that nature. So kind of a wide range of species and resources that we protect in the county, whether it's under the county umbrella or, again, these separate agreements we have with other folks.
As Commissioner Gardner, I had an issue like right before Christmas, and I had river otters killing my koi. They weren't eating them, they were just killing them. And I know I called somebody and nobody offered to come. I mean, it was like 2, I believe.
But Patty, you probably called ODF&W and the call didn't get referred to us. And that's an issue that can happen.
Right. Anyway, well, thank you for clarifying that. Yeah, they just killed all 7 of my giant fish in my pond, and they did not eat them. So I was very sad.
And river otters are something that we do deal with and would help folks out had we got the call and made contact with yourself. So
Okay, so it's just a transfer of that call then.
Yeah, unfortunately, not a lot of times, but sometimes the calls will come into ODF&W to their front desk. It doesn't really go to a biologist, and it kind of goes through a screening process, and we're up to the judgment of the person that's taking those calls as to whether or not they actually get filtered out to us or not. So, yeah.
I didn't get filtered.
Yeah. Can I, okay, so you mentioned that 80 of the properties that you responded to last year, you responded to under county funding. Can you give us a breakdown of how many of those were public properties versus private properties? And then I would love a little bit of a breakdown of kind of which kinds of animals you were addressing across those 80.
Yeah, Commissioner Chang, I don't have exact breakdown. I can certainly get that for you, but the majority of that work was done for like private entities, not public. Those public ones are more so where we have the financial agreements separate with them. And then other large private entities, say Sun River and Black Butte, for example. We're setting up separate agreements with large entities like that. So a lot of that work was done under livestock protection, and also more like local residential damage. We may have a flicker, tearing up someone's siding. We may have a skunk or a raccoon under a porch. But in general, those fall to helping private individuals, livestock producers, and other just private homeowners and things like that under that 80 number that I gave you.
Okay. So I heard woodpeckers.
Yeah, I've got another kind of a species list. I can list off when I pulled this report for the last year, kind of compiled the species that we've worked for in Deschutes County, and I'll just read them off here for you. Badgers, bobcats, coyotes, fox, Canada geese, magpies, rock chucks or marmots, pigeons, gophers, raccoons, ravens, ground squirrels, skunks, starlings, and wolves. So a big species list there in the county, really. We deal with burrowing rodent issues, deal with Canada goose issues and other nesting birds and damage-causing birds. And then, like I said, the small mammals, the skunk, raccoon stuff. And then generally the predator issues we deal with are damage to livestock or those public safety threats that come up from time to time.
Yeah. Thank you. And when you say livestock, that is protection from predators, or is that dealing with gophers so that, there's not holes to trip in and things like that?
It can be both. The focus is obviously the predation, and that's like the big driver, but certainly badgers and other burrowing critters out on pasture and stuff is another concern, and we will deal with those as well. Sometimes we're dealing with both on the same property,
Yeah.
I'm sorry.
For rodents, small mammals, birds, is there, do people have, private pest control options, like local businesses that could provide those services?
I'm sure there's plenty of private pest entities in Deschutes County and probably based in Bend and elsewhere, certainly.
Right. Yeah, I mean, what I'm getting at is there are certain kinds of animals that pose significant threats to people and property and livestock. There are certain kinds of animals that are dangerous. Even river otters are actually pretty dangerous. There's animals that are dangerous to deal with. I mean, to people. I mean, but there are other things like raccoons and woodpeckers pulling out, messing with the siding of your house, things like that. I question whether those are the responsibility of the county to support residents with with managing or dealing with. So I just want to say that there are a lot of things that Wildlife Services does in our community that I think are really valuable, important public services, but I'm not sure if everything you've described today are services that justify public investment in the services. So I'm trying to parse that apart a little bit to get a sense of, if that's the way that I would sort it out. I'm trying to get a sense of what the amount of funding that you would be requesting from the county would look like if we split it into kind of those two bins. Can you give me a sense of that?
Not right on. I mean, because we had put less than 24 hours to really prepare to talk to you folks. But Commissioner Chang, let me just kind of on that little tidbit there of, what little creature actually can cause yourself a monumental problem. We dealt with one this last year, and that was where we had the ground squirrels, Belding ground squirrels, in and around the irrigation ditches, which is like all cute and everything. But then it turns out we ended up having badgers that were in pursuing the ground squirrels, which ended up burrowing huge holes in the dikes of the canals, that causing structural issues that you could lose your water system. So on some of that stuff, it does go back and forth, but mostly like the ditch stuff is handled differently. But the other thing, we don't advertise at all. So the private pest control folks in Central Oregon, I do not believe is that actually handles the raccoons, skunks, and so forth. I don't know that there's a huge contingency of folks that actually handle those complaints. ODF&W, for the most part, when there are those types of complaints come through, quite often they filter them through the private pest control people first before they end up coming to us. And it's not a greater percentage of complaints that we deal with. The raccoon thing, more than likely the raccoon or the skunk thing is usually some little old lady who's having a hard time paying her light bill and her grocery bill that has a skunk that's spraying her house, and she can't afford the $500 that the private pest control outfit's going to charge to remove the skunk. So there's my 2 cents, sir.
Mm-hmm. Going back to your irrigation canal example, did the relevant irrigation district contribute anything to controlling that?
I believe they did at that time. That was last year, a year ago. But I was just giving that as a for instance that, something that looks like a minute problem that could be taken care of with a couple of mousetraps and so forth could end up ballooning into something much greater that ends up costing the county more money.
That ends up costing somebody more money.
Right. Absolutely.
Somebody in our community, and
Right.
I'm not saying that pests shouldn't be dealt with and predators shouldn't be dealt with. I'm saying I'm trying to understand who it's appropriate to ask to pay for that service. And again, I'm kind of in my mind, I would sort it into, there's certain kinds of animal control services that are really urgent public priorities, and there are other kinds that I think may be private interests. It's not that I'm not sympathetic to people who have a skunk near their house. I'm just asking whether it's appropriate for the county to be paying for that. And kind of along those lines, I do want to raise for the budget committee that over the last couple of years, Wildlife Services was providing with federal funding, was providing a very important service in our community. A guy named David Andrews, who was doing essentially wolf depredation prevention work. A lot of his work was carcass removal around the community because, carcasses of, cows or other livestock that have died not from wolves but are on the landscape are an attractant. We had, unfortunately, the federal funding for that program was terminated, and so we lost David Andrews. And so there's an example of a service that I would like to see Wildlife Services providing, that if we're going to be contributing funds, I'm wondering whether we could be contributing funds to those kinds of services rather than dealing with a skunk by somebody's house. So that's part of what I'm trying to get at as well is, if the county has limited funds to contribute towards Wildlife Services, what could we be asking other people to pay for? And what are important services that Wildlife Services can provide, maybe, in that specific case, that Wildlife Services is uniquely qualified to provide, for the dollars that we're contributing.
Absolutely. And so know this, sir, we work for you, and, if the county deemed that the funding need to be used, and this happens in other counties, don't think that Deschutes County is unique in this respect. Everybody likes to know where their money's being spent, and sometimes we want to spend it in different avenues. Myself and Matt are both in favor of however you want to do it, and the whole non-lethal wolf thing, to be able to funnel county funds to be able to help those people that are having those issues, we're absolutely on board with that. So, but one other little caveat, and I want to share this with you, just so know this: when you enter into a contract with us, we also get the ODA and ODF&W dollars that go into that county fund that help offset some of those costs for that raccoon or the skunk type issues as well. So that isn't all coming out straight out of the county coffers. It's a cost shared event. It isn't something that we go, oh, Deschutes County is going to pay for this. It comes out of our account that says Deschutes County, but that has the ODA and ODF&W and the federal dollars all lumped into that, and then we draw from that. Does that make any sense?
Yeah. And I mean, I'd also be curious, how simple is it for you to accept partial payment or cost share from a private property owner as well? I mean, we're talking about braiding funding streams together here.
And we do that. We have an accounting list for Deschutes County, because we have two very active employees there that are aggressively going after private dollars as much as they can to offset funds being spent by the county. So yeah, we are all about being able to go out and get money wherever we can get it to keep our guys funded and supplied with the equipment to do the job properly.
I think statewide, we have 300 and some different accounts, and only so many of those are counties, right? So it's a common thing that we do, as Brian spoke on. There's that cost sharing component that for Deschutes County at the budget request that we're making, it's a significant amount of dollars that would be put up in that state and federal funding kind of cost share. And just Commissioner Chang, just to kind of touch on the point about wolves with the loss of David Andrews. Like right now, we are filling in with our Deschutes County specialist based out of Lapine to do ongoing wolf kind of monitoring and tracking, responding if there is any damage. As I mentioned at the last wolf meeting that we were at, he's there with the Ty that was with me. He's going to respond to carcass removal if need be. So we have an asset on the ground that's going to do that work in lieu of the federal funding that was taken away. Long term, we'd love to have a federally funded specialist to work all of Central Oregon, and we're currently working on that, but it's not an imminent thing that's going to happen tomorrow. So we're lucky we've got Ty and we've got Brian there in the county to help out with that. as issues fall in Deschutes County. They're not going to work Crook County, but they're going to work for the producers in Deschutes County that have wolf conflicts coming up.
Brian, I was just talking to someone from Three Rivers and they said, oh my gosh, we've got a wolf here. And I'm talking to somebody and they're saying, no, there aren't. And yes, I go, yes, they are. So anyway, someone from a media company
Right.
witnessed him or her.
So what I see in front of us right now is there's really three aspects to this contract. The first is solid waste, because you are doing work on solid waste sites for, it looked like mostly migration, bird and wildlife migration, but there's probably some management on there. And that's something that I believe solid waste has. Do they have it in their budget?
Yeah.
All right.
25,000.
And then there's an additional 5,000 for property management, and that's specifically focused on Deschutes County property. Is that in the property management budget?
Yes.
All right. Then the third component of this is, as proposed, transient lodging tax in the amount of 126,000 to extend the work with that USDA Wildlife Services is doing to countywide wildlife services.
Right.
So that's really the deliberation or the discussion that's going up in front of the budget committee here.
Are they available 24/7 if you do have a problem? How do you, Brian,
Yep.
can we hold to someone 24/7 if it's necessary?
Yeah, I mean, if somebody's having an issue, they call us, we respond as soon as we possibly can.
Okay. As long as you get the message.
As long as, and this is where, and I've met with all three of the commissioners, as we know, that's why we want to get our phone numbers out to the commission as well as ODF&W, just so that kind of thing doesn't happen. But yes, our employees, although they're paid for 8 hours a day, sometimes that 8 hours may start at 5 o'clock and work until 5 o'clock in the morning.
Thank you.
Okay. And as is, there's a specific contract that is already done for the countywide management. Is there, I'm asking, is there, because I don't negotiate contracts, I just decide budgets. Is there a negotiation on the 126,000 for the countywide management? It sounded like you were saying, you're passing around the hat in a variety of ways to try and figure out how to do this. So if the county would want to do something less than that, they would have the ability to go negotiate a contract with you to change or adjust the services that you're rendering. Is that correct or not?
Yeah, I think so. Just the level that we're currently asking for is what keeps us at the level of work that we currently are providing for the county.
And to have two people available to respond as the county, as funding, whether it's county or other entities, comes down, then we go from full-time to less than full-time service in some capacity. And we're providing less service to the folks that are calling us. We're going to have less availability.
So the approval here is there's already $30,000 that's approved. What we are discussing, and again, correct me if I'm wrong, what we are discussing as a budget committee is an amount, I'm going to say it this way, not to exceed 126,000 that is made available to the county to be able to negotiate a contract with USD Wildlife Management for countywide wildlife management. Is that a fair way to put it?
Yes, and also what the source of that funding would be. That there's a proposal for that comes from TLT. But like I said, depending on what kind of service we're talking about, there may be other places that it's appropriate to charge that to.
Well, this is a current level of service that's been picked up by solid waste. So that's what we're doing, is breaking it out into 3 different sources of revenue from the county. From their point of view, it probably still looks like the same.
So, so I, as the budget committee, I'm asking the question back to the county. what are we trying to approve here? I mean, right now I see a not to exceed 126,000. Does the budget committee have the discretion to determine where this funding is coming from? Or do we just have the discretion that says you're proposing not to exceed 126,000 out of TLT?
We do need direction of where the funding source will come from, whether it's a general fund, TLT fund, or another appropriate fund.
Are
Oh,
there,
is there room in TLT then for this fund, this 126,000?
It would come from the discretionary portion of TLT, which would thus reduce the contribution to the capital fund. As we talked about, the remaining funds are transferred into the capital project fund. So it would reduce that amount.
it would leave us just short of 1.5 million going into the capital fund, if I'm right.
Correct. Yeah, because
Yeah.
we were planning on transferring 1.6 million roughly.
Yeah, and then in the debt service that the capital fund is paying, that we're assuming that TLT is providing is about 1.5 million. So we would be eating very slightly into the capital fund to pay the debt service on the courthouse. No?
No.
No, we would just be eating into the transfer that we're going to make to the capital reserve fund because we transfer less and we would transfer the 126,000 to the solid waste fund, which would reduce the transfer to the capital reserve fund.
Okay.
The debt service isn't involved.
The
Okay,
debt, it
so-
does not apply to this.
So to put it in terms you used earlier, Jim, we have, 400,000 of additional TLT above budgeted, and we're trying to not let it burn a hole in our pocket.
Yes. But it might be fixing a hole in the ground in a pasture.
Absolutely. Yeah. No, and I mean, that there's good reason for us to look at each special request separately, one by one. But I just want to float the idea out there. We have 3 general fund special requests. I think one of them, the assessor's request, is actually, the other 2 are, can we use general fund to provide services? The one from the assessor is, can we use some general fund to make a foundational investment in maintaining and growing our assessed property tax base? And I think that might actually be a more appropriate thing to direct some TLT to than other things. And and what that would do is that would allow us, that would free up the $350,000 of general fund special request money to spend on community justice and health services.
Well, but depending.
But that's, I mean, if you're, sorry, to our guests, but if you're asking me whether I want to spend, a chunk of TLT on something, I would much prefer to spend a chunk of TLT on our assessed property tax base, than on, woodpeckers and rock chucks and ground squirrels.
Well, that'd be until you open your door and there was a
Right.
counter in front of you.
Yeah.
Well, I'm not saying that the cougars and the bears and the wolves and even the river otters, because river otters are they're really dangerous animals. I'm not discussing that component of the request. I just feel like there's a component of the services that are being provided that I don't think is really the county's responsibility.
Well, and again, we're not here to argue the semantics of the contract. What I'm trying to figure out, honestly, is how much money do we want to drop back into the county's lap so that you can figure out how you want to manage this and explain it to the public. That's not the purview of the budget committee. The purview of the budget committee is, do we want to spend $126,000? Question 1. And question 2 is, from what fund? Okay. Do we want to expend an amount not to exceed $126,000? Question 1. Question 2, what are the available funds that we could discuss that we could choose not to exceed $126,000 in pulling out of our pockets, burning or not? So is that a good conversation that the budget committee would like to have in the next 10 to 15 minutes? Okay.
And one other thing I wanted to, and hold your ears, Jeff. One of the things I wanted to, kind of, put on the table is, solid waste has been, a great community partner shouldering the entire cost of this wildlife services contract for a number of years. Even though a lot of the service being provided has no direct bearing on solid waste business. And I want to appreciate that, and I want to relieve that burden, but I also, to withdraw so much funding all in one year is a little bit rough too. So I mean, we could consider a ramp down of solid waste contribution as well.
Well, that's the from that we can discuss the next. So I don't think we're voting yet, but I'm just kind of getting a consensus. Is there an interest from the budget committee in taking a vote on a not to exceed of $126,000? And I think the motion would be to transfer to solid waste in support of the wildlife contract.
If the budget committee chose to use TLT funds, yes, we'd need the motion to say that we're approving up to 126,000 to be transferred from the TLT fund to the solid waste fund.
Okay, well, so so first would be the 126. Again, we're not voting yet because I want to get the from different. Is the consensus without a vote of tell me if I'm getting into dangerous territory here. Is the consensus of the budget committee that we're interested in exploring a not to exceed of, put your glasses back on, 126,000 to support countywide wildlife management, that the county can then contractually negotiate as to what type of genus, phylum, whatever is done? Because that's not, I mean, to put it nicely, that's not our problem. That's the county's problem. We're just trying to figure out whether we want to make it your problem.
I like the idea of having these professionals in this domain in our county. So, it's grown from the starlings at the landfill to other services. Solid waste has taken up this whole thing. The contract is bigger than maybe would have thought that it would be. It grew over time, which is fine. These are the numbers that are presented to us, but I do lean into it.
I agree.
So do I.
I do too.
Okay.
We're talking about up to
A not
to exceed.
Well, I think the motion should be a not to exceed, because again, that's a tool or an opportunity for you to go back and negotiate with these fine gentlemen on how to help that happen. Now let's talk about the where. Right now, TLT is in front of us. We're structuring a motion here at some point. The TLT is the opportunity in front of us. General fund was another one that was mentioned as an opportunity in front of us, but we have a very limited amount of discretionary funds in general fund.
Yeah, from finance's perspective, we would prefer TLT just because, again, the constraints in the general fund, we just don't have that additional capacity.
Are there any other county funds from which this could come that have headroom that could be used in a discretionary way?
Well, I think Commissioner Chang mentioned that, splitting it with solid waste, kind of folding it into the overhead of solid waste, where it's coming from, where the discussion is. That means TLT would, reimburse only half of that request, but the commitment by the county proper would be to fully execute a contract. I think that's where you were going.
I'm picturing getting towards a contract with a narrower scope of services that staff can hash out with wildlife services over time. Because I don't think we have the data, which properties, what species, how much of the time, how many incidents are this, how many incidents are that. We don't have the data to negotiate a contract, the specifics of a contract on the fly right now. But if we're working towards a more specific contract, like a year out, I am saying that, maybe solid waste can cover a portion of what they've been covering kind of with the expectation or the commitment that we'll work towards right sizing their commitment by next year. I do also want to say that managing predators that impact agricultural businesses, I think is a reasonable thing to consider. A reasonable thing to consider funding out of lottery dollars. Now, for this year, we've already made our lottery dollar allocations. So, and like we can't necessarily add that, but that is something to consider in the future. In the same way, if we're putting lottery dollars towards environmental health, restaurant inspection function to support our restaurants, right? Putting some lottery dollars towards, predator management for our agricultural businesses is, very much an economic development investment, in my opinion.
So if I can summarize, given the conversation here and the looks that I've been getting to my right, video lottery dollars might be an option in future years. They are not an option in this current year.
To clarify, I sought an opinion from county legal earlier this year as we were trying to identify a potential funding source for this. And they advised that video lottery, this would not meet the eligibility requirements for video lottery funds. So I don't believe that it would be an option in the future either.
Okay, but it's
I think
certainly
we'll
not
go
an.
back and revisit that with them with this predator livestock plan specifically.
That's great. It's not an option this year. That's the only question. Wait, this is a budget. We're doing 1 year. So it's not an option this year. Everybody agree that it's not an option.
I think the dollars have been out.
One additional future piece to put on the table
We do our
is that,
contingency, okay.
if we are talking about wolf depredation prevention, last year the state legislature passed Senate Bill 777, which will, allow essentially more funding to address wolf depredation in the state of Oregon. And then this year, the state legislature passed a new state TLT allocation, which is going to back Senate Bill 777 up with money. So there will be more prevention, wolf depredation prevention funding to apply for in future years. Our Wolf Depredation Compensation and Financial Assistance Committee can apply for more of those funds. And then we could turn around and contract some of those dollars back to Wildlife Services. But that is, again,
a problem for later. Yeah. So go ahead, Christina.
I'd like to make a motion.
Sure.
I move that we move transient or fund the solid waste department budget special request through the transient lodge tax for $126,000 to support the fiscal year 2027 USDA Wildlife Services as described in the budget packet.
I'll second it.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor?
Aye.
Aye. Opposed?
Opposed.
All right, motion passes. I would encourage, obviously, conversations internally with solid waste on the value of the TLT dollars and the value of negotiating a not to exceed contract with appropriate services. But at the same time, I want to recognize that the USDA is doing a valuable service to the county, I'm sure. And as a citizen of the Deschutes County, I thank you for everything that you do.
Thank you immensely.
Thank you.
Thanks for watching the lasagna get made.
Thanks, everybody. Have a good day.
All right. We're getting on toward noon. That was when we had scheduled in the agenda for lunch. I didn't see, did lunch show up? Lunch did show up. So why don't we take a 30-minute lunch and then we will come back and continue to address special requests.
Yes.
All right. We're All right, we are back. Thanks again to the citizens of Deschutes County for the fine but affordable lunch. We are continuing in our deliberations of special requests. We have finished our discussion of the wildlife management contract, and we are now on to general fund special requests. I believe there's a little bit of an update before that Kim would like to give, and then I'll also pass it over to your team to give us some guidance on how to address the special requests.
Okay, so I passed out Steve's email over the lunch break, but he responded to the additional questions that the budget committee had. So he said that for these are the entire cost to produce the pamphlets for each of the elections that he listed. For the May and November 2024 and each even year, the costs include the voter pamphlet printing, insertion into state pamphlet, mailing / distribution by state elections, and audio transcription. For the May of 2025 and each odd year, the costs include voter pamphlet printing, mailing, distribution by vendor, and audio transcriptions. And so the numbers haven't changed. So the May primary election, the number of pamphlets printed was 103,000. The size was 24 pages, and that cost was roughly 13,000. The November general election, the number of pamphlets was 105,250. The size was 40 pages, and the cost was roughly 20,000. And then the May special district election in 2025 was they produced 97,300 pamphlets, also 40 pages, and about $25,000. And he said if you have additional questions, he's happy to come down and answer those as well.
And that tells you the state of the printing press business in Oregon, just right there.
Serious inflation.
And not slowing down either, from my understanding.
I don't know, from my perspective, it's pretty cheap.
Yeah.
I mean, we're talking 30 cents for one of these kind of documents.
Yeah.
Yeah.
That's darn cheap.
It's cost effective. And big picture, if after hearing Steve's presentation, anyone was thinking about like, oh, well, we could save a bunch of money by just not printing and mailing these anymore. We're not going to save that much money. Right.
So, and again, as a citizen of Deschutes County, I appreciate the county helping us get informed so that we can understand how we're casting our votes and do it knowledgeably. So I appreciate, and again, my citizen opinion is money well worth the price. So let us move on. Let's talk a little bit about guidance on. Did you have more to say? Okay, I didn't. There was a little conversation. I wasn't sure whether it's shut him up. Okay. So let's talk a little bit about, do you have any proposed guidelines or any way that you want to do it, or should we be discussing that as the committee?
I don't think we necessarily have any proposed guidelines. You have the 3 special requests, and you have all the materials in your special request section. And as I noted, we've made an adjustment to that summary to reflect that the assessor's request is now 125,000 versus the original 350,000.
Okay. And in the detail of the special requests, I believe, is the cost breakdown on the other two, because there were a couple of tiers of things that we could do. First of all, I think we should thank the administration and the staff for winnowing out the special requests and getting it down to 3 that I think are very worthy of special requests personally. We have 2 in front of us that are similar, at least in form, which is your money funds a person or persons to go be able to do certain things, little bit in terms of either contracts or technology on the community justice side, as opposed to pure people. But I think it's easily breakable in terms of this replaces a person or this contract replaces hired staff. Assessor's office is a little different because it is software. Obviously, I'm checking, but I believe that any software approval would then need to go into a full county process. It would have to go to IT. there would be an evaluation as to how it gets integrated into the environment. There's an RFP, there's bids, all the rest, but we have an idea of a, to use the terminology we were using before lunch, and not to exceed type of opportunity to get the assessor's office new technology to be able to save people and better contest tax contests. So, or better respond to tax contentions. So those are the three that are in front of us. Let's, at this point, I think we're discussing and debating for some period of time, and we'll figure out how long that is. Any opinions on special requests or anything that you'd like to get out on the table for the rest of the budget committee?
This was scheduled, kind of proposed to have a chunk of money to be able to allocate, right? What's that amount again?
150,000.
50 is the number to kind of the container we could work with here. So from the discussions and working my way backwards on the proposed list here, a point of clarity, just as a starting point, 125,000 for AI, supporting juvenile court security, dedicated juvenile judge, justice, and difference to 350 going to health services. Is it proposed?
I mean, the 16,000?
Would be 125 plus 92.
Oh, you just want to do the one?
So then it'd be 125, 92, and then whatever the difference is to 350. So everybody gets something. So it's just a moment as I was clicking off things. It could fit.
The judge is 60, and what else are you picking up?
The judge and court security, juvenile court security, they go together. So they add up to 92, 60 and 32.
But before we jump in, could I ask one clarifying question? The finance team has provided us with this analysis and this space to add 350,000 this year. Is the assumption with these 350,000, if we add 350,000 worth of FTE, that then we will be able to sustain that in our out year projections?
Yes. So sorry, go ahead.
In our out year projections, and one of the reasons that's important is because the assessor's request is a one-time request. That is not something that we'll have to do another 125,000 next year and another 125,000 next year. So
There is probably some minor maintenance costs that are associated, but it
Yeah.
would be the 125.
right.
But yes, you are correct. The way I've modeled this in the general fund long-term forecast model is a 350,000 ongoing expenditure, and then of course adjusted by inflation annually.
You can go back to
Okay. Yeah, but helpful to know. That was a good clarification. Thank you. So
One item that I just want to put out there for the committee's consideration. So over the last 5 years, on average, the assessor's office has had about 500,000 of budget savings annually from naturally occurring vacancies. So even with the limited growth that we put in place for this year of 3.3%, we're projecting savings of about 450,000 in that office this fiscal year. And as the assessor mentioned during his budget presentation, he is utilizing 143,000 of budget savings to meet his baseline to basically balance his budget. But I think even with this utilization and based on some of my preliminary estimates of the impact of the wage equity project and a potential vacation payout depending on the election results, I think there would likely be enough savings to absorb a one-time cost of 125,000 within their proposed budget. And since general fund departments don't carry forward savings or ending fund balance, this wouldn't negatively impact his budget in fiscal year 2028. And so if the assessor didn't end up having that kind of historically average budget savings, he could always come back to the board to request a budget adjustment. And I know Commissioner Chang, you mentioned TLT. Maybe it could be structured where it could be a TLT transfer, but only if it was needed, if they didn't have the budget savings to pay for that one-time expense.
But that would be an adjustment that would go in front of the county probably middle of the year,
Yeah, or at the end of the year in June.
June, yeah.
So you're projecting they're gonna have 400,000 of budget savings this year.
Correct, which doesn't carry forward for them, but if you just look historically at their naturally occurring vacancy savings, it's around $500,000. And so we would anticipate that it would likely be similar.
Right. And that was one of the things that they were basically asking was, if we could just keep whatever we save at the end of a year, then that would be helpful too. And so this is a way of actually, giving them back 125,000 of that for an investment they want to make is kind of like letting them save, bank their savings.
It wouldn't necessarily be giving that back to them, but it would just be assuming that they would have similar savings in fiscal year 27, that they would be able to absorb that 125,000 without needing additional appropriations.
Yeah, I think the proposal is not to carry forward savings from fiscal 26 into 27 because general fund departments don't carry anything from fiscal year to fiscal year. It all just goes back to the main part of the general fund, but rather looking at the average savings year over year, allowing them to, or anticipating that their savings that they have accrued, over the past 5 years.
Yeah, so over the past 5 years, on average, it's been about 500,000 annually that they haven't spent out of their budget.
But we're still over a month away from the end of the fiscal year. And if they have a few $100,000 of savings this fiscal year that they're going to have to give back to the general fund, couldn't we just as easily do that budget modification for the current fiscal year before it ends?
Well, I think that they wouldn't be able to actually make that purchase before the end of the fiscal year. And so that would be appropriations in this fiscal year, but they would really need those appropriations in fiscal year 27.
Okay.
And just quickly, the reason why we don't carry forward funds in the general fund. So general fund year-end balance is treated as a government-wide resource, not a department-owned surplus. And there's various reasons for that, but it keeps fair control over limited public dollars, avoid treating public funds as department-owned. It preserves ending fund balance for cash flow and financial sustainability. It's a direct available resource to the highest current priorities, and it prevents uneven results where some departments build up spending capacity while others can't.
So there's an opportunity potentially for the budget committee to provide some sort of advisory to the Board of County Commissioners that would say, if there is a necessity for the assessor to go over budget in support of absorbing this $125,000 in the existing budget, that the finance committee is passing to the county our support of the office going over budget by some amount and requesting a budget adjustment, with an understanding that this is fairly important because if implemented correctly, this is going to preserve future tax collections for the general fund. Let me stop there. Objections, comments?
But am I hearing from you that you're saying they already have it in their budget? I'm confused.
No, it's not currently in their budget. But what the point I guess I'm making is that I think that they would be able to absorb 125,000 one-time costs within their current fiscal year 27 budget without increasing appropriations, just given the historical savings.
So, yeah, let me say it more plainly. I think what it effectively would be, and I don't know if it's a motion or I don't know if it's just an advisory consensus, but I think this is an opportunity for the finance committee to say, if there's an ability to absorb this in the assessor's budget, we recommend that the assessor include and move forward with $125,000 and work with IT and get everything absorbed in and get this done. If in the process of that, the assessor's budget does not actually have the room for the $125,000 and the office would need to come to the Board of County Commissioners for a budget adjustment in the future, the Finance Committee would support it because we support the purchase of and implementation of the software.
And I think the key is if this year's an anomaly and they have zero savings due to vacancies, because we don't want to say, plan for this out of the gate. If they're initiating recruitments today, they can be fully staffed. And if they need the full 125,000, then that would be available. We just want to make sure that we're not putting them in any position in which they're not able to hire at the full level. And if they didn't have one vacancy all year, just so that it's clearly on the record. Yeah.
Well, and it's not the job of the finance department, or I'm sorry, finance committee to tell them how to manage their.
It's not our job to say how to manage it, but it is our job to say, we support this and we believe that it can be supported in your existing budget. If it can't be supported in your existing budget, we as the Finance Committee would support you coming to do a budget adjustment with the Board of County Commissioners and would further recommend that the commissioners would accept that budget adjustment. Is that in legal wheels, or not legal, in finance weasel words, does that work?
Yeah, and Budget Committee.
Yeah, and Budget Committee weasel words. Okay, yeah. All the weasels, except the ones that the USD are chasing. Got to go back. Okay.
And just to add, and that option is presented so that then that would leave 350,000 for the remaining two special requests that from general fund use that the Budget Committee could also do, while still allowing that other project the ability to move forward.
Okay.
Commissioner DeVon, can you restate what you said about the community justice? Can you just?
Yeah, so as I said yesterday, I just started ticking off the things that were jumping out at me. So when we get back to community justice, if we support the juvenile judge, I would also support the juvenile court security. So it's just like a little sub package, community justice, which adds up to $92,000.
But I support the whole package for them.
Well, and that's fine. As I say, I was saying, I really supported assessor's office. So that's why I said I was worried about how much money we have. But now that that's off, different conversation.
Yeah, same here. So yeah, I mean, I'm going to say, I think the assessors, I think all three of them are, high priority. The assessor's office, I think, I just think for future revenue protection, we need to implement that. So let me ask a question. Is there a need for a motion, or has the advisory that the Finance Committee put on record, or Finance Budget Committee put on record for the Board of County Commissioners, is that sufficient for the administration to be able to move forward?
That was exactly my question to finance, and so I'll let them answer.
Sorry, I was just having a side conversation with Whitney, so I missed that.
God, you're all talking. God.
You were referring to the assessor decision.
Let's see how sensitive those mics were and see if the AI picked up any of it.
But we'll be right.
We didn't confer, but since we're not actually changing the assessor's budget, his approved budget or that department's approved budget, assuming the Budget Committee approves it, would move forward as is because we're not actually changing the budget. I think the conversation within the Budget Committee is sufficient to detail that, yes, the move forward with the project within your current budget, and it would be the board coming back to the Board of County Commissioners by the end of next fiscal year in June for fiscal year 27 if your budget needs the excess capacity, needs additional budget authority to finish that project. Yes.
I think there's a simple motion here. I mean,
you could do a motion.
I would move that there's support for AI-enabled assessment technology modernization for the assessor's office in next year's fiscal year. I mean, so it just, there's support here.
At 125,000?
Yeah.
What if, do we actually say that? Because
I don't think you need to say the number.
I don't think we do, because what if they don't get that number? What if through our processes, it comes out at 157,000 or something different than what we were told?
Does it say a simple motion saying there's support for the AI investment of the assessor?
So was that a motion?
Second.
Okay, we have a motion and a second. Is there any further discussion?
I guess one last thing to ask is the assessor's budget as presented here, it doesn't get to that level of detail. There's no line item showing either the presence of 125,000 AI investment or the absence of that at the, that's a discretionary decision that they're making within their budget anyway.
It's not explicitly in their budget.
Being somewhat of an unfortunate expert in budget adjustments, he would probably have to come in and do a budget adjustment at some point or another to note that there is a software line item in there.
What we would do if he had the savings to cover it and didn't need additional appropriations, we would just do an internal budget adjustment that doesn't require board approval, just to move budget appropriations from personnel to
materials and services.
Okay. Exactly.
Yeah, I mean, I guess I was just asking, should we do something to change the budget, their presented budget, but because we want to preserve for them the opportunity to fill that personnel, those vacant positions, I'm tracking that we shouldn't.
Yeah, I don't think that's necessary.
Okay.
One quick thing I wanted to just point out in community justice's special request, they did actually rank and prioritize their requests. So 1 was their top priority, with 4 being their lowest priority.
Let's come back to that in a minute.
Okay.
Yeah.
Yeah, and health services did that as well.
Yeah. Let's come back to that in a minute. There's a motion and a second on the table. Is there any further discussion? If not, I will call for the vote. All in favor? Aye. Any opposed? Any abstentions? Motion passes.
Now, if we only have 2 things left and we have $350,000, and we all think that these are very worthy things, would it make sense to just either split the remaining money 175, or split it proportionally to the size of their request?
I have a problem with that, because when I'm looking at what health services is asking, they're asking for 1 IDD specialist, 1 specialist. Now, I thought the reason why we were doing this was because their client have increased. And if they're only getting 1 specialist that actually works with some of those people, but they're getting an analyst and a technician, yeah, I'm really just interested in funding a specialist.
But just to be clear, at least what I heard from health services was they had a 2-tier request. It was 175,000 to fund an FTE, and then there was the additional 75,000 or 81,000 to fund the whole package. The 175 would go toward was going to go toward infrastructure matching and other things, which was going to allow them to get another person back and
Make lasagna.
Yeah, as they made the lasagna, the tasty lasagna, but I think their comment was, well, if we get the 175, we'll figure out how we can go munge the budget to maximize the value. They didn't tell us specifically what that would go for. Did anyone hear different?
Holly's actually still available. Would it be helpful for her to come back in and speak to
I think that would be useful, yes.
Holly? Let's see who gets here first. Holly on the delay with the live stream, or Eric going next door.
Yeah.
And just a reminder in there, and she could speak to it, but option A was the 256,000, and their option B was that $175,000 to preserve 1 of the 3 positions, and the other items listed in the detailed special.
So she'll be in a minute, and we can go have the conversation on what the 175 gets us.
But if you fund community justice, which has been terribly impacted, I mean, you can't even imagine how they've been impacted. That leaves 141 for health.
But just to be clear, 175 on community justice, as you look at their stuff, gets you everything but juvenile court security. So, Holly, why don't you? Oh, you got a microphone there. So
I do.
So, just in case you're missing some of it, let me summarize, and then my peers can tell me how wrong I am. So the discussion that we're having is you had a 2nd-tier request or an option B of $175,000. So can you re-inform the committee to make sure that we're all on the same page, how you'd spend that 175 and what that would get you because Patty's comment was, again, not putting words in your mouth. Well, I'd like that specific body. I didn't get the impression that that was how you were going to spend the
You said
money.
Preserve one of the three positions. Which position? Are
Yeah,
you-
so the 175 would do would allow us to not implement mandatory furloughs for the intellectual and developmental disabilities program. And then it would allow us to preserve a position, but we would need to go back, crunch those numbers and determine what position actually makes sense to keep for a department and how it all kind of plays out with match and everything. But that mandatory furlough option would be then off the table.
So, and if you take the mandatory furlough off the table, is there an equivalent of an FTE that like a quarter or a half or something that equates to?
If we take this, ask the question one more time.
So if you're taking that mandatory furlough off the table, so as I understand, it's across the board, 11 days off. You have fun trying to figure out what you're going to do because we're not paying you. So if you take that, what does that equate to roughly in terms of an FTE that you get back? 11 times how many?
Well, it's in various classifications and various positions at various steps. So I don't know that.
I'm not going to hold you to it. Well, and this is why you got to figure it
How many
out.
person hours would that get us back?
How many person hours? Well,
Yeah.
Oof. I don't know off the top of my head.
11 times the number of personnel times
Yeah.
Wait, let's just math real quick.
times 10 because you're all hard workers.
So the mandatory or the furlough option is only available to full-time staff. So IDD does have some part-time staff and those would not apply. So let's just for round numbers do 40 staff at 8 hours a day for 11 days.
320, 3,200, 3,200 and change, so 3,300.
3520, 1.5.
This doesn't,
Usually I'm better than that.
this doesn't
lot
make
of out.
sense in here. You say that a caseload of 54 clients per service coordinator. Now, I thought you said we had like 42 service coordinators.
So
And we have 1,086 clients, is what you said.
yes, so the way that the IDD looks at caseloads is with IDDS2s. So the number of IDDS2s and the caseload, the number of clients equals the caseload. So if we add these staff, it doesn't change the caseloads for the staff specifically. So what it does do right now is
What it did is I took 1,086, divided it by like 42, and it's 23. Each person has 23 people.
yes.
So
yeah.
why are you saying it's 54?
Yep, so it's within
go.
certain classifications. And what this specific request would do is right now, the work that we're talking about these staff doing would have to go somewhere. And where that would be going is to the IDD specialists. And they still have their full caseload.
That makes sense.
So while in terms of numbers, it may not impact the caseload per IDDS2s, because that's how that number is being quantified. What it does do is hopefully preserve the staff that we do have, because I think what we're going to see is higher turnover because of burnout, because of administrative burden and other requirements that this particular program has to comply with. And the monitoring, it's not just the match, we also have to do a certain number of encounters and then document it in order to meet that match amount that would come back to us. So it's kind of constantly a monitoring game that takes away from the time with the clients, but somebody somewhere has to.
Yeah.
do it.
And this is what the management analyst position is really keeping a close watch on whether or not we're meeting our encounters, the number of encounters we need to do in order to draw down that match.
And just playing a little further, if you take the 3520 hours that you're doing and you divide that by 52, that's about 68 hours a week that you're getting back. So a little more than a full-time person.
1.69.
Yeah. All the engineers come out. So, Patty, did that help answer your question specifically?
I know, I just feel that the parole and probation people got hit like big time. And I know IDD is a problem, but I just feel like parole and probation, the 209, their ask is to me, you know, they need some help.
Well,
And, you know, the health department may need some help, but, I feel like parole has a bigger ask.
which is fair. I want to scope this one and then I want to go and I want to make sure that we're all scoping that one. So right now, let's stick to scoping this one. We know what the 175 gets us. We know what the 256 gets us.
It's
I
only 81,000 more.
I really wish I didn't have to do the glasses on, glasses off thing. Are there additional questions that we would have in terms of the two tiers for health services? Okay. Let's get to, thank you very much. High fives all around. Okay, now let's get to community justice. So so they have put a price tag on all four of the options, and I believe these are in priority order, right? So there's the 0.4 FTE community justice officer at 67, a dedicated juvenile judge, which is 60, so that would be 127. The reception kiosk at 50K, which would be 177. We've hit our ZBB line if we're going to the 175, or for an additional 32K, you can add in the juvenile court security, and that would be, if you fully fund that and push the rest to health services, we're not solving any requested problem, but we're at least helping them solve a problem. So go ahead. I think there was some input.
I think we got a message from community justice staff indicating that if it helped, they would be happy to, if the budget committee were inclined to split this and allocate 175,000 to community justice. They feel like they could make that work and they would do their best to preserve all four of the items as best they could. So I think they are also monitoring the conversation. So to the extent that that's helpful.
When we approve special requests, are we approving the specific menu items? Or are we, I mean, can we just say, here's 175,000?
That's within our
use it for any of these four things in the proportions that you want. Yeah.
That's what we're doing, isn't it?
Yeah. So if
No, I mean, I'm just asking if we say, no, we want you to do items 1 through 3, whether they're restricted to that.
we can be prescriptive, and then that just means that we don't trust people to do their job, honestly. At least if you ask me. I think it's very possible that we could entertain a motion that would deliver $175,000 to the health services and $175,000 to community justice out of the general fund.
Second.
We have a motion and a second. Is there any further discussion?
As long as DV brought it up. Otherwise, we've been listening, DV.
This was Trevor, and I know that
Trevor.
DV has immense trust for Trevor, so I'm.
Yeah.
Trevor, I hope you didn't.
That was authorized.
All right, we have a motion and a second. Any further discussion? If not, I will call for the vote. All in favor? Aye. Any opposed? Any abstaining? Nope, motion passes. And are there additional special request items that need to come in front of the budget committee? I believe no. Okay. We were supposed to be done with that at 2:30. It's 1:05. We do have a recess built in. Would everybody like to take a victory 12-minute recess and reconvene at
Recess right now.
and that's what I'm asking. You just want to keep going? All right. Next item on the
The momentum is going.
we're gonna break in this somewhere. Because we are at a totally non-controversial portion of the agenda right now, which is the elected officials' compensation approval. I will turn this over to Whitney to guide us through where we are. And this is in our book somewhere. It's in supplemental, I believe.
Supplemental, Cam?
Yeah. It's somewhere back.
It is.
Yeah, it's in the back.
It's 53,000 in the back.
Whatever you need.
All right. Thank you, Chair. I think our HR director, Susan DeJudy, is coming down. But I think just to get us started, in your binders, you have a summary of the recommendations from the Elected Officials Compensation Committee, which met earlier this year. Reviewed attached data that was prepared by HR Answers and recommended compensation rates for elected officials for fiscal 2027. All of the recommendations from the committee were approved unanimously, with the exception of the vote for the compensation for the clerk and commissioner compensation. Those were 2-to-1 votes. I'm going to run through the recommendations from the committee.
Hey, Susan.
Hello. But before I do that, staff did just want to note in preparing for today's meeting, one item, and that was during the Elected Officials Compensation Committee meeting earlier this year, there was a little bit of conversation that preceded the vote on clerk compensation relating to when the clerk's position had been eligible or received a COLA. And we did want to clarify that the clerk did not receive a COLA last year. And I think the discussion amongst the committee members could have been interpreted as that position had. So just a point of clarification there before I get into the recommendations from the committee. So the committee recommended 0% adjustments for the clerk position, commissioner, and treasurer roles. There were recommended adjustments for the assessor, the district attorney, the sheriff, and the justice of the peace, and those are detailed in the materials that you have before you. We're happy to answer any questions, but I think that that's in the high-level summary what we wanted to share to start today's conversation.
I think it would be appropriate. There were the three citizen members of the budget committee were the elected officials compensation committee. If there's any thing that any of the three of us would like to just add in terms of their perception of how things went on, I think this would be a good time to do it, because there was some lively discussion. So if there's any, any opinions that didn't necessarily carry forward an emotion that you'd like to get out, you're free to do that.
I'm good with what
I'm fine.
Same as well. It's the rest of the elected officials compensation committee is free to ask questions about the last meeting if they have any clarifications, and I'm sure staff or us can answer those. How's the best way to address this? Do we want to go one by one, or what's the discussion?
I think if there was a motion to there could either be a holistic motion or motions individually by classification or by position, depending on the nature of the motion that was entertained.
Okay. Before we take motions, are there because there's a good potential that we could do this just as a slate, but before I try and do that, are there any questions about any of the specific recommendations that that anyone would like to bring in front of the elected officials compensation board?
Question about the assessor. I looked at the Clackamas Lane, Marion, whatever. All of them are less than what we pay now, and yet we're going up to 190.
Commissioner.
Compression, I believe, is the answer.
Yeah, with the impacts of the market study that will go into effect at the tail end of this fiscal year, there would be compression between the deputy position in that office and the elected assessor position, and that is what drove the recommendation, or at least was presented as a factor for the committee to consider informing their recommendations. Historically, the budget or the elected officials compensation committee has looked at those two roles and the compression that exists between them, and has attempted to maintain a set point so that compression does not exist.
Did that answer your question?
Oh, yeah. No,
Okay.
now we're way above. Yeah, everybody else.
We are not allowed to talk about what might happen if our deputy assessor is elected to become the assessor next year, are we?
I think you
We actually did bring it up in the,
'Cause I mean, if the problem is the compression from the deputy director, if the deputy director position becomes vacant, that's an opportunity to look at resetting that as well. But I don't know if then there's another third tier of compression of positions below that.
it would be dependent on, again, correct me if I'm wrong, it would be dependent on who would be put into that position, what their longevity is, what their thing goes in, which might either negatively or positively affect the compression one way or another. Is that fair to say?
I think that's fair to say. I would also just say that the compensation philosophy drives where that deputy position is being placed within the range of other positions that we have here at the county. So we're looking outward at our comparable organizations and using that data to inform the placement of that role. So adjusting that compensation is a little bit problematic because it would be out of alignment with comp philosophy, which could cause some imbalance structurally within the organization of how are other roles with that type of responsibility compensated.
You call that a wage equity?
Not an Oregon wage equity factor. I would call that kind of it would cause the compensation structure to be out of alignment if you did that.
I'm gonna say that it came up in the meeting that there are benefits of the non-elected, and again, make sure I'm remembering it right. There are benefits that are associated with the non-elected position that are not available to the elected official. And it was pointed out that the loss of some of those benefits would potentially make the county assessor a less desirable position, i.e., I could make more if I stayed where I was. So we did raise it, but we didn't raise it to the recommended level. And it was pointed out that there might be some disadvantages to it. That would not prevent the future elected officials compensation committee to be looking again at what the HRA answers recommendations are, which would be probably potentially another substantial increase depending on circumstances.
Oh, the assessor was recommended to do what's up to 17%.
And I think what did we choose in the end? I know what it went to, but it was what did we 10%?
We'll follow up. I don't have that in front of me, but we can follow up and get that.
There's all it's all in here.
Well, it's 190. I just couldn't remember how many percent that was.
Yeah, I don't have the percentage right in front of me.
10 sticks in my head. But I could probably look at the sheet and do math if we needed to. Anyway, that's the assessor. Other questions on the other slate? Just from a reasoning standpoint, if I remember, again, team, remind me, Dave and Christina, DA, sheriff, and, well, let's take DA, sheriff, and justice of the peace. I think we were pretty chalk on the recommendation, if I remember. DA is always very tricky because the county is absorbing more of the burden of paying the DA because the state isn't specifically changing, and when the county makes a change to try and bring the DA up, it's very disproportionately coming on the county. I mean, we're doing very high percentage increases. Again, as a personal opinion, I think DA Gunnels is absolutely worth it, and you know, I'm good with that. But that is a burden that the county does very heavily have to take on in the general fund to be able to make sure that that position is filled. Go ahead.
I was going to say it was 8%.
Okay. 8%. Thank you.
Original question.
Yeah. Yeah. Thank you.
And yes, I will agree with you that we are so fortunate to have Steve Gunnels as our district attorney. You know, he was born here, lives here, raised his family here. He's, you know, we're very lucky. I'm so glad he hasn't burned himself out. Because how many years did he say he's been working? Like 35 or something?
35, yeah.
Yeah.
But to go back to the comment yesterday, he's good eye candy. So,
oh, yeah.
And everybody would need to go back and look at that rather than picking on me for saying something I flip off the cuff. the treasurer, because the treasurer position, I think there's only, yeah, there's only one candidate for treasurer this year, right? Okay, so it is very likely, absent a massive write-in campaign and undeserved write-in campaign, that the treasurer position will get absorbed back into the CFO position. And while we didn't have that knowledge at the time, you know, we didn't want to make any changes based on that likelihood happening.
It'd be like a stipend is a percentage of the position, but this sets that in percentage or sets the foundation for a number.
I don't think we did.
But I mean, there's something.
There is something historically that does the stipend as the percentage of the position.
There's past practice that documents what happens when that role is shared by the CFO. I think what the elected officials compensation committee did was not to modify the existing compensation. So essentially maintaining compensation for the role had it been filled by someone who was not
Exactly.
in a shared position.
Yeah. And then questions on the other two?
Can you remind me again? So the clerk's position didn't get a COLA. And I mean, you know, I can see where that position is playing out in terms of comps plus 5%, but did other positions not get COLAs? Other elected official positions not get COLAs, or is that exclusive to this position?
The commissioner position did not receive a COLA either.
Nor the treasurer, it says.
Well, the treasurer we've already discussed, but yeah, it was just I think we've gotten on that, but
He did get it?
No, you are correct.
Correct. And Commissioner Chang, you're talking about the recommendations for the coming fiscal year, not my comment about the prior or the current fiscal year COLA. My clarification at the outset was more having to do with the COLA that was received this year, clarifying that that position did not receive a COLA this year. It is also not recommended to receive a COLA in the coming fiscal year based on the recommendation of the committee.
I mean,
And generally, I think that's driven somewhat, the committee takes into account the recommendation of adjustment for the role. And so I think the recommendation there, the committee's recommendation was in alignment with the recommendation from HR Answers for that position.
I was actually trying to remember that.
yeah. I mean, I can appreciate the thought that goes into setting the pay kind of where it is, but you know, for a position like the clerk, you know, it isn't these are all serious public servant positions, you know, not to get a COLA for a couple of years in a row just doesn't seem.
There was a similar discussion in the prior committee, and the vote was to keep it where it was.
And if you read in the notes of higher clarification under clerk, under the notes and consideration, the role is 2% above the goal at base pay and 4% above at total pay. So they're already above. Not at,
There are other positions in this list that are already above.
No,
No.
nobody's, they're
They're
at
the
the
only
top
one.
already.
they're the only.
Yeah, they're, the compound, yeah, they're above everybody.
What about at the new levels that are being proposed?
I'm not sure what you're asking.
Yeah.
This was dated June 30th, 2026.
Yeah.
I mean, the meeting was in January, right? Because we held it right after the mid-year.
But this.
I'm asking about these numbers.
Okay.
So when these various positions get to these numbers, will they be right at 5% above comps, or will they be higher than that?
Very.
I mean, you know, like the assessor, as we were just discussing, is way above comps.
Right.
Is way above, but is also below the recommendation that was given to
Right.
the committee.
Correct. And I think to dovetail on Jim's question from a few minutes ago, the district attorney's position is below, and has been. So, I think that you're seeing both kind of with the recommendations that you have before you.
And I had asked, I wasn't sure what the compression looked like in the district attorney's office at the time of your meeting. There would be a temporary compression issue for the first 6 months of the year, from July 1st to December 31st for the district attorney. And then the state's projected increase would then be implemented in January 1st, so that compression would not be an issue. I mean, right at the borderline, it's like 10 point something percent, whereas we look at compression at 10 to 15%. And I didn't have that information as your initial, and I'm not making an argument one way or the other. I'm just providing the factual basis that the first 6 months, there would be compression with the chief deputy district attorney and the district attorney. And then I think the district attorney's increase was 6.7%. I think it was 4% plus the 2.7% COLA.
Yeah, there was a COLA that was in there, but again, it was significantly higher on the part. So it was 6.7% total salary, but it was a very large number because Deschutes County absorbs most of that cost. So and just as an offhand comment, I think the first question I asked was, "Wow, these numbers are really different from the last year. Why?" And we got I think a very reasonable explanation as to why, but not to be suspicious or anything, but I think there's a lot more criteria that's going to be coming in. And next year, we're probably going to see some different numbers based on compression, based on some of the wage studies that are rolling in, and then based on some of the other conditions that we use to pull this in. So these numbers are just Jim's simple explanation. These numbers are always going to be wonky. We did what we could to be not only prudent in terms of ensuring that the people in front of us were fairly compensated per the information that we were given, but also trying to be fiscally responsible because this is a not insignificant impact on Deschutes County's budget. So, I mean, we're talking about the clerk. Did that answer your questions?
Sure.
Okay. Other questions on this? Are there any opinions in the room on any potential adjustments? We'll listen to any opinion. We might not do anything about it, but we'll listen to any opinion. I would entertain a motion if there is a motion that somebody believes could be offered. Or we can keep talking, or we can just all stare at each other.
Move approval of elected officials compensation committee salary recommendations from January 16th, 2026 public meeting.
We have a motion. Is there a second?
A second.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor? Aye. Opposed? Okay, so we have 5 yeses, 1 no, no abstentions. Motion passes. Fight the good fight, Chrisana.
Wait, was it 5 or was it 4? Or
5 yeas. Patty was a quiet yes. Yeah, she was.
Really?
Yeah, you just weren't real vocal. So 5 yeses, 1 no. Motion passes. All right. Now we do need a recess because there is, well, I hear some furious typing on the keyboards in the back there. I think that you need a few minutes
Yeah,
to get us to the number.
be pretty close, but why don't you give us 15 minutes?
We are going to, I'm going to give you 16. And we'll check back in. So I will give, we're going to take a 16-minute recess. We will convene at 1:45.
Okay.
All right. And we are back. We have a new piece of paper and it's the magic paper dust has settled on our desk. So, Kim, why don't you tell us what we got here while we stall to get Patty back in the room?
Yeah, so adding those special requests that were approved, that brings the total county budget to $705,986,745.
Okay. Nice number divisible by something, I'm sure, at least by 5. And then in front of us, we have all the other activities as well. We do have a quorum in the room. Is everybody good with moving forward, or do we want to take a second?
We can move forward.
Okay. Let us move forward. We are at the item, we are at budget approval items. The first item to approve is the Deschutes County budget itself. The motion is written there. I would entertain a motion.
Yeah. Oh, yeah.
Nice lady under the elevator. Yeah.
Eric can be the Boy Scout.
We appreciate your desire to help people. Truly.
Standing out there.
No, she's had a stroke and she said that she needs help. I mean, and like we're, having help. So anyway, of course I'm helping her.
You're doing the Lord's work, Patty. All right. I would entertain a motion.
Okay, I move to approve the Deschutes County budget of $705,986,745 and set the tax rate at $1.2783 per 1,000 of assessed valuation.
I'll second.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor?
Aye.
Aye. Any opposed? Any abstain? Motion passes. We will now move on to the Deschutes County 911, the Deschutes County 911 Service District. I will open the public meeting for the Deschutes County 911 Service District. As introductions, we are the Budget Committee. I will open this up to public comment. Is there any public comment in the room? Seeing none, is there any public comment online? Seeing none, we can move to the discussion. We have discussed the budget. I think Sarah and her team did a very effective presentation, and there are 2 motions in front of us. I would entertain the first motion.
Move approving Deschutes County 911 Service District budget of $26,367,775 and set the tax rate at 0.3618 per 1,000 of assessed value, Fund 705.
Second.
We have a motion and a second. Any discussion? Again, I will note that 911 is the only taxing district in the county that still is not charging the maximum, and we as taxpayers appreciate that. Any other discussion?
Isn't it the only district that's not charging the?
I think we're the only taxing district, or they're the only taxing districts. Yeah.
Yeah, they're doing their floor upgrades. We saw the photos. We have the backup center in Redmond now. The radio system towers have been installed. The system's kind of optimized for our P25 system partnership with the state. It's really exciting knowing that we have a great foundation there. Next step is Next Gen 911, which is kind of going a little bit more digital connections, virtual connections. So there will be some big moves out there sooner or later, technologically.
Absolutely. Anything else? If not, I will call for the vote. All in favor?
Aye.
Aye. Any opposed? Any abstention? Motion passes 6-0. There is a second motion on the table regarding the 911 Service District. I would entertain that motion.
I'll move to approve Deschutes County 911 Service District Equipment Reserve Budget of $5,463,000.
Second.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor? Any opposed? Any abstain? Motion passes 6-0. I will close the public meeting of the Deschutes County 911 Service District. And I will open a public meeting for the countywide law enforcement district number 1. We are the county budget committee responsible for the approval of this budget. I will open to public comment. Is there any public comment in the room? Seeing none, is there any public comment online? Seeing none, we will move to the budget discussion. We have in front of us a single motion for approval. I would entertain a motion if somebody would like to offer it.
Motion to approve countywide law enforcement county service district budget of $65,527,000 and set the tax rate at $1.25 per 1,000 of assessed valuation.
Second.
We have a motion and a second. Is there any further discussion?
Just acknowledge Sheriff, in his comments, he said, morale is up and costs are down. I was like, oh, that's the message right there. That's pretty exciting to see that. He's such a natural with the finances, on top of being a leader at this time.
I think we've been seeing great momentum from the sheriff's office and in the last couple of years. So yeah, I totally agree. Good job, Sheriff Ty.
Let's not go back that far, but yeah.
True. All right, we have a motion and a second, right? Yeah. I will call for the vote. All in favor? Aye. Any opposed? Any abstain? Nope. Motion passes 6-0. That is approved. I will close the countywide law enforcement district number 1 meeting and open a public meeting for the rural law enforcement district number 2. We are again the county budget committee that approves this budget, and I will open for public comment. Is there any comment in the room? Seeing none, is there any comment online? Seeing none, I would entertain a motion.
I'll make a motion to approve rural law enforcement service district budget of $22,349,000 and set the tax rate at $1.55 per assessed $1,000 of assessed evaluation.
Second.
We have a motion and a second. Is there any further discussion? If not, I will call for the vote. All in favor? Aye. Any opposed? Any abstain? Motion passes 6-0. I will now close the rural law enforcement district budget meeting. We are at the closing comments section of the budget committee at 1:52. I'll just point out. So we have time to talk. Just don't do it for too long. Actually, I think it is, I think it's worthwhile. Let's talk. This is first of all, I'll say thank you for entrusting me to be the chair of the budget committee. I don't take it lightly. Thank you all for your participation in the dialogue and the conversation that we have. I value it, and it's very educational to me to see it. I really wish more people would pay attention to things that are this important in the county. But the fact that they're not, and we still take it as seriously as we do, I think is a credit to all 5 of you, as well as the staff and the incredible finance team that we can acknowledge. So thank you all. Comments. This is the last time the 6 of us are going to meet. The next time it's going to be 10 of us, and it's going to be a pretty different 10, no matter what. So things that we want to pass on to enable the future budget committees to be successful, or any reflections that we'd like to do on the process this year.
Gosh, I've been in the budget. I was here in 2018 for most of the time, and I find it incredibly, I know people can watch online and everything, but it's really unfortunate that more people in the community aren't engaged somewhat. I was sitting here with Erwin. We were in the room. I think it was upstairs, in fact. So yes, we it just keeps going up, and thank goodness for those Triple Crown awards, because I do love the Triple Crown. So no, it's great, that we're part of a very small group in the state of Oregon that actually does such a great job. So
Deschutes County Secretariat and Seattle SLU.
No, how about
Affirmed.
American Pharaoh and Justified?
True.
Those are the Triple Crown winners that my husband took care of the owner. So
1916, we seceded from Crook County, so we're about 110. So I wonder what the first budget was. Was it in 1917 or in 1916? So about 110 years, as I say. I mentioned that first of this year, but it might have really been next year. It would have been 110 years. But Deschutes County has been growing ever since. Timber was the big thing. Now we've got the Old Mill retail and concert district down there. 210,000 people. The budget's grown a lot. These are challenging times, knowing that we're not growing in our FTE and service level, but the budget's still growing. But we're healthy. We've got some reserves. We're making good business choices. Very professional budget was put in front of us. It's funny when we get down to those last little special. Well, let's just cut it in half and send it half each way. So, which is wonderful. But yeah, now we're going to go to five commissioners, 5 public budget members. So thank you for your service as public budget members. Coming up speed, having a few years under your belt is the value there. So Dave, thank you very much. And I saw how fast you were running numbers, and you came up with the number like everybody. So I'm sure you'll do fine here. So
Thank you.
and Chrisanna, I think end of the 3-year term, but we'll see if we get you reappointed here. That'll come up later this year. So thank you so much.
Well, I very much enjoyed serving. I'm a big old budget wonk. I love to go through the budget. So I very much appreciated being included in the process. So thank you. And great budget.
Yeah. Well, and Jim, you do a good job running.
Thank you. It's only because there's such a good crew egging me on.
Here we go.
You keep us in line.
Well, I would just say that this is our second year of limited growth. There are cities and counties and other governmental bodies across the state of Oregon, across our nation, that are struggling to make ends meet and to provide critical services within available finances. And I was just remarking that last year we said, oh, the second year of limited growth is going to be rougher. And while we that there are things that have happened this year, there are things that we are seeing projected forward in our budget that are hard. The fact that we have kind of taken bites of the apple over a longer period of time to get us to a more sustainable place is makes it not too brutal all at once. And for that, I definitely think we need to thank county staff that have shepherded us through this process, and particularly shepherded all of the county's departments through this process. We need to thank those departments for putting on their thinking caps and being super creative and identifying ways to, again, provide the excellent level of service that the people of Deschutes County expect, while limiting growth and living within the means that we have, and thinking towards a future that might be even tighter and has a whole lot of federal and state uncertainty in it. So thanks to all of the county staff who have made this a smooth process, and thank you to the budget committee for deliberating the hard things that we had to deliberate and getting us to a pretty good place. I mean, I was looking at all those special requests, and I was seeing a whole lot of important stuff that I didn't think we had enough money for. And we were able to figure out how to address all 4 of those important special requests. And that's something to be celebrated.
Well, this is the 17th budget I've sat through. So it's not my first rodeo, but I will say this is the best rodeo I've ever been to. Jim, you ran a great meeting. I learned a lot from you while you were doing this. Your staff is the best staff I've ever worked with on a budget process. I wouldn't change a thing about this, especially in the future. I think it allows not only the commissioners and the staff to participate, but even to a certain extent, the public to express their concerns about what's going on. I've learned a lot. And I'm very proud to be on this this board. So I'm looking forward to what comes next.
Go ahead.
Thank you, Chair. I just, first of all, thank you for the nice remarks about our team, because this is a total team effort, as I mentioned at the beginning. And thanks to all of you for your extraordinary work over the last 2.5 days. Hard to believe this previously took us 4 days, and now we're been 2.5 days what we've accomplished. And it was really, really thoughtful, really great questions, great discussion. And also very efficient as we move through the entire process. I really want to, before I want to thank a lot of people. I want to thank all the department heads who have participated and presented. I thought they just did a really, really great job presenting this year. And I want to just point out Jeff Curtis, Jeff Merwin, Kim Riley, who sat in for our legal counsel, Sheriff Rupert, Holly Harris. Hopefully I'm not forgetting any of the new presenters. And Susan, of course, Susan, yeah, of course, Susan. I was trying to quickly remember our human resources director. All of them who I thought just did a remarkable job. They fit right in and jumped right in, and were very, very informative. Brenda Friswold, I forgot to thank you with my opening remarks. Thank you, thank you, thank you. You've been here with us through the entire way, and you make this happen, as do Kim Catcher and Eric Brion in the back. And of course, I end up saying very little throughout the process because of the support that we have with Whitney and Eric and our deputy county administrators. And then the big kudos goes to our finance team. Robert, Cam, Laura, Dan, you make this happen. And thank you very much. Really, really great work. To prepare for it on the fly throughout the meeting, and then to get us across the finish line. So thank you all very much.
And I'll just say, I agree with Commissioner Chang, for the fact that this is I always say the hardest thing to do is doing something the second time, and hitting that low growth targets the second time. It went very smoothly, and that was a factor of who was in the room, but that was really truly a factor of all the employees of the county who participated in creating all those budgets. And there was probably a little less smoothness and a little more crying and wailing for the last few months, trying to pull everything together to get to a point where it could come in. And I really think that it's a healthy but painful exercise for any organization to go through. But I think the county's going to come out a lot stronger in this. As things continue to be limited growth, we're all maxed in terms of where we are. Remain serious about this, and it will get easier and, dare I say it, more fun to be able to pull together some of these budgets and be able to find the ways to responsibly account for, collect, and spend taxpayers' money for the betterment of the citizens of Deschutes County. So I appreciate all that. There is one little note that I'll have. And I can't remember when it was a few months ago, Nick pulled this out of a bag and said, "Oh, you got to see this." So if you can't see it on the camera, it says Budget Season Survivor. So and Nick said, "Oh, you'll have to wear it at the end." And I decided, no, we can start a tradition, and then we'll have to figure out how to continue it. But I think we can award the Budget Season Survivor to our new budget committee member.
Oh, we're proud.
Yeah. So Dave, my suggestion is bring it back next year, and as the semi-honorary first budget season survivor, and as you and I can collab and figure out who we're going to give it to next year, and we'll just make it a round robin. So don't lose it, or at least buy a new one if you do. All right. Any other comments for the good of the order?
He has another one in his office that says, "I read the packet."
Oh.
So we could circulate that one around the budget committee too.
That one will work as well. All right. Is there anything else for the good of the order to come in front of the budget committee?
I did just want to say one thing. I want to wish Laura a happy birthday. She got day at the budget committee meeting, but
Yes, happy birthday. We'll sing later because nobody wants to hear me singing, and especially nobody wants to hear it recorded. If not, if there are no other things for the good of the order, I will adjourn the budget committee and look forward to the next mid-year, probably in January.